Okay, Allison, I think you can go ahead and get us started by welcoming us as the numbers still continue to come in.
Great. Good afternoon, everyone. My name is Alison Barkov, and I'm the Principal Deputy Administrator of the Administration for Community Living. And I'm thrilled to call to order this first joint meeting of the Raise and Supporting Grandparents Raising Grandchildren Advisory Councils. Thank you, everyone, for being here with us today and for helping us mark the start of a year that will have us finally producing a much needed and long overdue national caregiver strategy. We'll be joined a little later in the meeting by HHS Secretary Xavier Becerra, which is a testament to how important your work is, not just to ACL, but to the Department of Health and Human Services, and indeed to the nation. I want to thank both councils for submitting their initial reports to Congress late last year, and for all the work you've done to identify the major issues facing caregivers. As you all know too well, COVID-19 has shone a spotlight on the fact that families too often have had to fill in for the lack of needed services, whether it's because of loss of services during COVID-19 or because of the long-standing gaps in our long-term care system. COVID has also laid bare the risks of living in institutional and congregate settings, making the work that we need to do to support family caregivers so their loved ones can stay at home all the more urgent. President Biden is well aware of the debt our nation owes to family caregivers, as evidenced by the fact that his Build Back Better plan contains supports for the nation's caregivers, as well as for the people they support. The public and media are also finally recognizing the importance of family caregivers, with nearly daily stories about the challenges caregivers are facing throughout the pandemic. Your reports have provided some of those stories, but we all know there are 53 million unique stories in America, one for each caregiver. Yet they also share things in common, and they share unmet needs. Right now, today, when 1 in 7 of us serves as a caregiver, we know that people need more support. And that's why you all have come together to shine a light on the many, many positive aspects of family caregiving and to plan the way forward so we can finally have a whole of government caregiver strategy. As I've said before, the greatness of the work you are doing lies in the strength of being able to leverage our relationships with our sister federal agencies so we can move forward together with a strategy that will fundamentally change the way our nation views and supports caregivers. We are so grateful to the John A. Hartford Foundation and their grant to the National Academy for State Health Policy, which has really helped us come to this moment. I also want to thank the National Alliance for Caregiving, the University of Massachusetts Boston, and Community Catalyst. The contributions of each of these organizations has been invaluable, and I truly want to thank them for their support and partnership. Now I'll hand the floor to Greg and return in a little while to introduce the secretary. Greg, the floor is yours.
Thank you so much, Allison. And on behalf of my team, and I believe I speak on behalf of our council members here, thank you so much for your dedication, your support, and your truly genuine interest in the work that we're doing. It is so wonderful to have the support of your leadership in the work that we're doing. So my role here today is to kind of make some important announcements for you all. This is as much for the council members as it is for members of the general public. But my team and I have been working very closely in collaboration with our colleagues at NASHP to formulate a working plan for the rest of this year as we move towards completing the development and dissemination of the National Family Caregiving Strategy. And that's a lot of what I want to spend my time talking with you about, is the approach that we have developed and will begin to lay out for you. First, though, I did want to give a bit of an overview of today's agenda for those of you who aren't aware. It is a jam-packed agenda, and we are going to try our darndest to stay on track throughout this day, so that we can get in all of the great information that we have. And then what I'm particularly excited about is our final session of the day. If we can go to the next slide, please. So we have two really amazing presentations this afternoon. One by the folks at UMass Boston and Community Catalyst on the outcomes of their stakeholder listening sessions, which I think as we begin working with you on the development and finalization of the National Caregiving Strategy, you're going to see the literally tons of information that they have collected and organized and analyzed for you. And then we have a great panel after that, focusing on caregiving, employed caregivers and financial preparedness, two topics we haven't touched a whole lot on in our meetings together, and so we really wanted to use this opportunity for 3 short presentations on some work and study that's been going on in that field. We're after our meeting. No, could you go back, please? After with the welcome remarks from Secretary Becerra, we also have a unique, hopefully fun and maybe enlightening introduction exercise for the council members, since this is the first time since August of 2019 that you guys have all been at the same meeting. If you remember our first meeting, we had all you guys in the same room. We swore you in as special government employees. It was really cool. And then the pandemic hit and you guys haven't seen each other. So we want to use that opportunity to reintroduce yourselves, because you're going to be working together a lot over the next 3 months. But we have an interesting complete the sentence exercise that we hope will get us some really, really good quotes and insights that we can drop into the National Family Caregiving Strategy that Sarah Markell will talk to you a little bit more about where we are with that, and it is really amazing. If you can go to the next slide. So, as I had mentioned, our colleagues at NASHP and my team here at ACL have been working very closely since our meeting in September, when you guys released that initial report to Congress. And we know that the next step is the development of the National Family Caregiving Strategy. And we also knew at the time that we needed to have our colleagues on the Advisory Council to support grandparents raising grandchildren be part of that process. Kinship and grandfamily caregivers are an integral part of the caregiving community out there, and their voices and their needs and concerns need to be included as part of the national strategy. So following the release of their report in November, we set to work laying out a work plan that will hopefully get us through the completion of and delivery of the National Caregiving Strategy to Congress and really to the rest of the country. So we have devised this working plan that will begin following our meeting together today. And as you'll see from Dr. Nadash and Eileen Tell's presentations, as well as what Sarah Markell will share with you, we have already done with the development of the strategy, we need to pull you guys together in subcommittee meetings during the months of February, March, and April. We have gathered a ton of information. We've begun organizing it and categorizing it under each of the recommendations, but we really need the joint efforts of the RAISE and the grandparent councils to come together in subcommittees to really begin to fine-tune each of the actions that are going to be included in the first edition of this national strategy. And so we will begin that work in earnest next month, and we have a whole schedule laid out, which I'll get to in a second. We also plan to hold a couple of federal partner convenings. Beginning in November, our federal partners, members of this council, as well as the federal members of both councils, as well as parts of agencies that are not represented yet on either one of these councils have been providing input for what the federal actions will be on the national caregiving strategy. Sarah is going to give you a pretty high level and I think quite surprising overview of the amount of information that we have gotten from our federal partners to date, and we still have more to go. It is our intent that once we have all of the input from federal agencies is to begin to organize and put that together and then convene our partners across government to really look at all of the actions we have submitted and then use the time to identify areas where we as agencies can collaborate, maybe reduce any duplication or eliminate duplication, and really develop a way forward over the next couple of years for how we as the federal government will better support and recognize family caregivers. We had initially talked about either a two-phased dissemination of the national strategy, meaning we were going to release the federal portion first, maybe earlier in 2022, followed by the dissemination of the other sectors addressed by the strategy. This is still in flux right now, and you'll see why after Dr. Nadash and Eileen Tell and Sienna Ruggieri give their presentations. We have already gotten so much information from stakeholders about what states can do, communities can do, health and long-term services sectors, that we may actually be in a very, very good position to pull the entire strategy together at one time, but it will require a very, very concerted and dedicated focus during these subcommittee meetings in February, March, and April to really begin to bring all of that together. So that is still a TBD. We'll see how things move, but our intent is to have the completed strategy done by no later than August of this year. And between now and the end of August 2022, we are looking to have two more full joint council meetings just like this, tentatively in May of 2022 sometime, and then somewhere in the July-August timeframe, we will see how everything goes in terms of when we would schedule those meetings. So that's kind of our anticipated work plan. We will be interacting with you a lot over the course of these subcommittee meetings, in prepping you and then in coaching you and really working with you to sort through all of the actions that have been culled so far, and we know that there are more to come, and you all will then be able to put your great minds to providing us with some additional actions that will, speak to each of the recommendations. If we can go to the next slide, please. So one of the things that we've looked at, each of the councils has had their own set of subcommittees. And they have worked, the RAISE subcommittees have worked on the RAISE report, the grandparent subcommittee worked on the grandparent report. Now that you guys are coming together to focus on the development of a single comprehensive national caregiving strategy, we want to bring the two groups together in a set of subcommittees comprised of members of both councils, both federal and non-federal. And the primary task of those subcommittee meetings will be to finalize the actions that are included in the National Family Caregiving Strategy. That will be the focus in monthly meetings during, as I'd said, February, March, and April. We are going to have the subcommittees organized across the 5 broad goal areas that are very, very complementary in the RAISE report and the grandparent report. So there will be a subcommittee focused on awareness and outreach actions, another one focused on engagement and partnerships, a third one focusing on strengthening services and supports, financial workplace insecurity, a huge important issue, and then a 5th subcommittee that will look at actions under the recommendations in the data research and evidence-based practices broad goal area. After the meeting today, either this afternoon or tomorrow morning, each of the council members, both federal and non-federal, will receive an email with a doodle poll. And the doodle poll will allow you to sign up for one or more of these subcommittees. We have already pre-selected the dates. And we've combined the dates that worked for grandparent council members as well as the RAISE council members. So each of the subcommittees will have the dates next to them on which those council meetings will occur, the dates and the times. So you'll be able to make your choice based partly on your interest and where your expertise lies, but also on what your calendar currently permits. And as I said, you can sign up for more than one subcommittee. That would be great if you can. The more the merrier, the more expertise we have at any given time on these subcommittees, the better. We're scheduling them for February, March, and April for now. We'll see how we'll take stock of where we are in March and April and maybe add a fourth one in May. We'll see how things go. But that is our plan for the formation of new subcommittees, which will take us through the completion of the National Family Caregiving Strategy by the end of August of this year. Finally, and then we'll open it up to questions because I'm sure there might be a few. If we can go to the next slide. So it's hard to believe, but we are nearly 3 years into our work. And, as I had mentioned earlier, both of these councils came together, were sworn in on August 29th of 2019. And you guys have been working like crazy ever since in some incredibly challenging situations, both, going virtual completely, plus dealing with the impact of COVID in each one of your lives. And yet you were there, you did it. And we are now seeing the end of the first, the first cycles of these councils. As you recall, the charters that you received with your nominations indicated that your term was for 3 years, which will be up in August of 2022. So we are planning to move forward with seating new councils in September of 2022. And so just as we did back, I think it was in 2018 or 2019, late 2018, early 2019, ACL published notices in the Federal Register seeking a call for nominations for the non-federal members of the council, for both councils. Our intent is to do that again this year. Hopefully in mid-February. I've begun drafting the Federal Register notices that will go out. That Federal Register notice will be open for 30 days. And we are looking, and it will be very clear about the types of nominees and the backgrounds that we wish to have represented on the council. For those of you familiar with the RAISE Act, you'll know that the RAISE Act is pretty specific about the types of non-federal, the types of individuals on the non-federal side who have to populate the council. It's people who work in healthcare, in aging, in disabilities, family caregivers, people with disabilities, older adults, and the statute is also very clear that the council is to reflect the diversity of family caregiving in the United States. And so we will be looking very, very closely at seating, at looking at a number of factors in seating new council members for both councils, including how the geographic and racially and ethnically diverse caregiving experiences that we can bring. What was interesting is that I think literally every non-federal member of our council had some personal experience with family caregiving, in addition to the fact that they represented veterans or were in the healthcare sector or represented state government. Everybody had some personal connection with family caregiving, including the ACL team. So caregiving obviously runs deep in this work, deep in the people who are passionate about it. And so we believe that we will have a robust call for nominations. Just to refresh you, for the RAISE nominations a couple, 3 years ago, we got over 300 nominations. And we will disseminate this call for nominations far and wide, and we'll be looking to our partners, all of you and all of the stakeholders in the aging and disability networks to really amplify that call for nominations so that we can cast the net as broadly and inclusively as we can and really garner slates of nominees for both councils. Once we have those nominations, we will have a multi-agency review and selection process. This will be a discussion with our federal partners later on. And I'm anticipating now email invitations early in June for new council members, and then swearing in of a slate of new council members sometime in September of 2022, at which point we will determine our way forward and what the next steps are. There's a ton of work to do. There always will be. And so this is our process looking forward for a new call for nominations. So stay tuned on that. With that, I will open the floor. Those were my business updates, but I wanted to open it up to the council members to see if they had any questions at all about anything I've discussed. And please don't be shy. Oh, you're not going to be shy.
Hi, Greg. Jaya with Generations United. In
Yes.
regards to the call for nominations, am I correct to understand that there will be parallel but different processes for the RAISE and the SGRG councils?
Yes, they will be discrete. So 2 RFIs, 1 for SGRG, 1 for RAISE. In looking at the charters that govern these councils and how they operate, one of the things we realize is the opportunity for closer collaboration. And so I think moving forward in the next iteration of the next, I guess, the councils 2.0, there will be a very, very concerted efforts to align their work, bring you guys together, cross collaboration, so that we can really make sure that we're taking a holistic look at and support of the needs of family caregivers of all types of situations. But they will continue to be their own separate entities.
Hi, Greg. It's Deborah from US Aging.
Hey, Deborah.
Hey, thanks for the help getting on the call. I'm assuming that ACL is looking for a new slate, a turnover of members for both councils. Is that assumption correct?
You know, I partially, I think we're still looking at that. Obviously, there's a lot of great talent and expertise here. There may be some folks who wish to drop off. But I think we would look at, we would be very willing to look at folks coming in for a second term on these councils. That's not something we've eliminated, and I think we would be wise to keep some continuity. So, it's not a definite no, but I think we would encourage repeats.
Thank you.
Mm-hmm.
Greg, this is Liz Sweet from over at SAMHSA.
Yes.
And I am wondering, under the open meeting laws, even if people aren't designated members of the councils, is there a large enough bandwidth for these remote calls for other people to join as listeners?
Yeah. So, I mean, this meeting right now is open to the public. And so we have we have our panelists side, and then right now we've got, it looks like about 136 attendees from across the country tuning in to watch. So all of these meetings, the full council meetings are open to the public.
Thank you.
Any other questions? So as we,
Greg, I'm sorry.
yes, go ahead.
Greg, it's James Cheeley,
Yes.
from Kentucky. Back when you outlined the new committees, is there any type of description that goes along with those committees when you do the poll this afternoon?
Yes, there will be a short description of the topics you'll be be discussing, they are directly aligned with the goals and the priorities. So if you look, for example, Mr. Cheeley, at goal 1 in the RAISE report, if you were to want to be on that particular subcommittee, you would be looking at all of the recommendations and actions that would fall under goal 1, which would be better outreach, awareness, and understanding of family caregivers.
Thank you, sir.
Mm-hmm. So as we wait for the secretary to join, the one thing I wanted to mention when that I wanted to make sure is when we're doing the introduction exercise after the secretary's remarks, is to turn on your camera so that everybody can see you. And this is we're hoping that this is a very rapid fire exercise. You can see we have 62 panelists. Not all of them will be introducing themselves because we have more panelists than we do council members, but it's really your name, your affiliation, where you work, and which council you're on, and then that quick complete the sentence, so that we can try to get through everybody in about 30 minutes, 35 minutes. We would love to be able to gather some really good talking points or sound bites that we can drop into the national strategy document, and also potentially frame some of those as outcomes or performance metrics. So that's what we'll be doing. I did also want to announce, and this was just brought to my attention, for those of you who may not have heard already, but Gail Hunt apparently passed away yesterday. Many of you knew Gail for her incredible work leading the National Alliance for Caregiving, the incredible work that she did with research, really bringing to the fore a true and better understanding of the needs of family caregivers. It was quite a surprise to read that yesterday, but I did want to acknowledge that, and also acknowledge that I think without her input and her advocacy, we wouldn't be here today doing this work. And so we really, maybe dedicate a portion of this meeting to her memory and in her honor. So.
Greg, Alan Stevens here. Thank
Yes.
you for saying those words. I support them fully. Her career has meant so much to so many.
Mm-hmm. Exactly.
So thank you for this. Thank you for that kind of acknowledgement of her.
Okay. Allison, do we know if Secretary Becerra is on yet?
I don't think I have a way to see that. Can you look in the session?
Yeah.
See? And while Greg is doing that, I just really want to add my thanks to everything that Greg said. I mean, this committee has been doing such important work at just the most pivotal time. I know each time I've spoken with you, I've highlighted that, the conversation and work around policy change focused on caregiving really continues. And I have heard just from across the federal government, from folks on the Hill as we engage with technical assistance, how important your report has been and just how much they're looking forward to this national caregiver strategy. So I just want to thank folks again and just remind you of just this moment in time that we have together to have such a huge impact.
Absolutely. And I see in the chat that at about 11:49 we were told that the secretary would be on in 10 minutes, and so hopefully he will be signing in. We hope that everyone had a happy New Year and safe holidays.
Greg, this is
Yes.
Lori. While we wait, Gail from the Advisory Council to Support Grandparents Raising Grandchildren was wondering how current members would need to be nominated for the new council if they wish to have an opportunity to serve again.
So for those of you, current members who wish to be considered for a second nomination, it would be the request for, or the Federal Register notice, like it did last time, will contain the information that we would be looking to receive about each nominee. So background information, why you're interested. A lot of folks who submitted nominations had support letters from colleagues that they worked with, members of Congress, their local delegations. They submitted their resumes. And so it's really anything that you believe you could send in with your nomination that will support and provide information for those making the selections and recommendations to the secretary.
Thank you.
Okay, so I'm hearing that he will be in shortly from both his assistant and also from our folks, and I see that he is in now.
Yeah, I'm in. I'm here.
Wonderful. Allison, do you want to introduce the
Yeah,
secretary?
great. Thank you, Greg. And I'm really honored right now to introduce HHS's secretary, Xavier Becerra. Throughout Secretary Becerra's distinguished career, he's truly been an incredible and passionate champion of issues related to caregiving, as well as issues impacting older adults and people with disabilities generally. As I'll share in a minute, he knows from personal experience the impact caregiving has both on the person being supported as well as on the caregiver. And he has been a supporter of policies that make positive differences in the lives of America's caregivers. I know from my own personal interactions with the secretary how much he values the work the caregiving councils are doing, and I cannot understate how important it is to have a champion like Secretary Becerra on our side. Secretary Becerra, we are so grateful for your continued support of family and kinship caregivers. Thanks for joining us today, and I'll turn the floor over to you.
Administrator Barkov, thank you very much. To members of the RAISE and the Grandparent Advisory Council, it's a real pleasure to join you, not just this afternoon, but to join you in this work that you're doing. I consider myself a pledged member of your council because what you're doing is so critically important. And I say that from my own life experiences. Today marks the beginning of the RAISE and Grandparent Advisory Council joint effort to develop the National Family Caregiving Strategy. I can't, again, overemphasize the importance of this day. More than 50 million family caregivers across the U.S. are counting on us to do this right. This begins the next phase of our federal government's efforts to recognize and support our nation's family caregivers. And when I became secretary of HHS last March, I knew that supporting family caregivers would be one of the critical assignments that we would have here at the Department of Health and Human Services. Both paid and unpaid caregivers are vital to the work that we do in our communities. They provide the support that allows millions of our fellow Americans to live in their homes and in their communities and do it by choice. Both kinship and grandparent caregivers provide leadership. They provide loving and stable homes for millions of children, those with disabilities, those who cannot remain with their household. And it is important that we recognize that. I know firsthand the sacrifice that caregivers must make. For the last 4 years of my father's life, he lived with my family. My wife, my mother, and my father, we moved them to where we lived, and so we could be closer to them. And certainly for the last 6 months or so, when he was less mobile, going through hospice, we were his caregivers for most of that time, with some additional professional technical help periodically. But it was really us who provided the care up until the very last moment when he passed on New Year's Day in 2020. So I know firsthand what so many of you have done, are doing, have experienced. And we know that this is something, a life experience for tens of millions of Americans. My father taught me that if he could get up in the morning and go to work, that was a good day. My father was a laborer all of his life. He started picking crops at a very early age in life. He moved on to fix railroad cars, to can tomatoes for Campbell's Soup, and then ultimately spending several decades working as a road construction worker. And for him, getting up and going to work was indispensable, because you don't go to work, you don't get paid. And in those days, there weren't many benefits for a lot of these laborers. And so I took very seriously whenever he would say to me, if you can get up, go to work, it's a good day. And I must tell you that the work that we're doing is critical here. So I want you to get up and go to work on this strategy, because we want it to be a good day for a lot of families moving forward in the future. When we lost my father, we realized the dignity in his life and in his death that he had a chance to experience. And we know that that's something we'd like to make sure is available to everyone. And I know that my experience is not unique, that others have gone through some of the same trials that my family had to go through. But I also know that there are a lot of families that wished they could have that type of a setting for their loved one in those final days, or during those days where there's a need for extra care. And so to me, while it was a trial, it was also a blessing to be able to be there to support as a caregiver for my father. Today, my three sisters and I take equal responsibility for caring for my mother, who's still fortunately ambulatory. And what we do is make sure that there's always someone responsible for her to help her, provide her, let her know we're there. And it really makes life a lot easier for her to know that she's got loved ones always surrounding her. She also still lives in my home. All of that's to say, when President Biden made the commitment to make caregiving a priority of his administration, we were there. We know that America is stronger as a nation when we support each other and we support our diverse communities. We know that there are people who are yearning to have that opportunity to show that they are willing to care for their own. And we know that people are doing it, and many times making major sacrifices and not getting a lot of outside help. And so that's why it's important that we do this right. Throughout my tenure here at HHS, the Administration for Community Living, our Administrator Barkov and her team, we are ready to go, and we are ready to work hard with you. She and her team have kept me informed of the work that the two councils have been doing, the ways you're helping to implement the requirements of the Raise and Supporting Grandparents Raising Grandchildren Act. Those two initial reports that you delivered to Congress last year provided, I believe, a compelling case. The testimony there was compelling, that was incorporated from family caregivers across the country. It detailed the need for a more cohesive, a more comprehensive approach on how we address the needs of our loved ones. And these reports offered a perspective few others of its kind have. Firsthand accounts of personal experiences with family caregiving. So invariably something that we'd love to be able to say all the time when we get these reports, but not something we can always really say is guaranteed. And so they've offered a perspective that is valuable as we move forward and hopefully get Congress to continue to back the work that we're doing. I'm grateful to all of you, and I want to say that right now up front, for your steadfast effort and for your inclusion of family and kinship caregiver voices and perspectives. We can genuinely say that we've been listening to what Americans are saying. And the work that you're beginning now, today, by developing the nation's first national family caregiving strategy is also critical. It's that first step in strengthening the caregiving infrastructure. The RAISE Act is clear in its intent for a national caregiving strategy. The strategy is expected to contain actions the federal government and its agencies can take within existing authorities, along with actions that states, communities, healthcare, and other sectors can undertake to better support family caregivers. In that regard, you will be creating a national framework and structure. Just to let you know, no pressure. With your combined knowledge and expertise, and it's a great bunch of people that are part of these councils, along with your own experiences as caregivers, I have no doubt that we're going to hit this one out of the park, because this one will be time tested, but with real experienced people in it. So if I can just close by saying, I very much look forward to receiving updates from Administrator Barkov and the team. I'd love to know more about the progress. Be prepared to have a few comments injected from my end, from my own experiences. And I will close by simply saying, on behalf of HHS and our entire nation, I want to thank you now for the work that you will be doing, the dedication to this effort. And I know that we will create a better future for our American families, because we will do it with love, understanding, experience, and without a doubt, with the grit and determination that every loved one brings to caregiving for their family. So thank you for being part of this team. And please know that many of us count ourselves as those who are following right behind you. Thanks very much. Turn it back over to you, Administrator Barkov.
Thank you so much, Secretary Becerra. Those words were so motivating. I think we have a big task before us, but both your words about the importance of the work that we do and the universality, really, of caregiving is so important. Thank you again. And I will turn it back to Greg to continue the meeting.
Great. Thank you so much, Mr. Secretary and Alison. Truly inspiring words, and I know, working with these folks as I have for the past couple of years, this means a great deal, and your support means so much to all of these amazing people who are working so hard on behalf of family caregivers. So again, thank you for being here. So, as I'd mentioned, we are going to go through a little introductions exercise, and this is intended to serve a couple of purposes. One is to reintroduce yourselves to one another, raise counsel to grandparent counsel, and vice versa, because you all got together in August of 2019 and then never saw each other again. But we also want to gather some visioning statements, and so we have provided a single sentence that we want you to complete. And so when you're called upon to introduce yourself, Cheryl will go down the list, give your name, your affiliation, and then complete the sentence. And do so, as quickly as you can, because we've got a lot of names to go through. So just a very quick completing phrase to that sentence. I would also welcome the attendees, the members of the public. If you want to drop in the chat, how would you complete that sentence? We'd love to hear what you have to say as well about your vision for what the national strategy will allow family and kinship caregivers to be able to do once it's completed. So Cheryl, I'm going to turn it over to you and we will get this started.
Wonderful. Thank you, Greg, and welcome everyone. I will start with the chair, co-chairs, then call the non-federal members, and then the federal members. We have Alison Barkov as our chair, but I don't know if you want to go through the demonstration. We can have...
Okay, sure, I'm happy to. So my name is Alison Barkov, and I'm the Principal Deputy Administrator at ACL. And once the National Family Caregiver Strategy is completed, family and kinship caregivers will be able to access needed services and know how to get them.
Wonderful. Thank you. Jaya Lent.
Thank you, Cheryl. I'm Jaya Lent. I'm the Deputy Executive Director at Generations United and the co-chair of the Supporting Grandparents Raising Grandchildren Council. Once the National Family Caregiver Strategy is completed, family and kinship caregivers will be able to get the support they need to help their families thrive.
Thank you. Dr. Ethelyn McQueen Gibson.
Good afternoon. I am Dr. Ethelyn McQueen Gibson. I am an associate professor at Hampton University School of Nursing, and I serve as co-chair of the Grandparents Raising Grandchildren group. And once the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to actually access the services that they need seamlessly without having to feel that it is a burden to be able to do that.
Thank you. Nancy Murray.
Hi, everyone. Once the National Family Caregiving Strategy is complete, family and kinship caregivers will be able to be more informed advocates and obtain the services they desperately need to survive and thrive.
Thank you. Did you want to provide your name and affiliation?
Oh, I'm sorry, Nancy Murray, and I'm with the Raise Family Caregiving Council.
Wonderful. Casey Shillum.
Hello, I'm Casey Shillum. I am the Dean and Professor of the University of Portland School of Nursing in Portland, Oregon. And I'm also honored to serve as one of the co-chairs for the Family Caregiving Advisory Council. And when the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to maintain their own vitality, health, and wellness.
Thank you. Alan Stevens.
Hello, I'm Alan Stevens of Baylor Scott and White Health, where I direct the Center for Applied Health Research. And I'm a co-chair of the RAISE Act Family Caregiving Council. Once the National Family Caregiving Strategy is complete, family and kinship caregivers will be able to access meaningful, evidence-informed community supports and healthcare services, regardless of the needs that result from their caregiving experiences, the age of the person for whom they care, or the longevity of the time that they provide care. Thank you.
Wonderful. Thank you. Ben Bledsoe.
Hello, everyone. Ben Bledsoe, President and CEO for Consumer Direct Care Network. My statement would end with, I'm with the Raise Family Caregiving Council. Statement would end, family and kinship caregivers will be able to better meet their needs and deliver even better care. Thank you so much.
Thank you. Joe Caldwell.
Hi, I'm Joe Caldwell. I'm at Brandeis University, and I'm also a caregiver of a stepson who's an adult with Down syndrome. And once the National Family Caregiver Strategy is complete, family and kinship caregivers will be able to feel valued and have access to the services and supports they need.
Thank you. James Cheely.
Good afternoon. I am a member of the Family Caregiving Council. My name is James Cheely. I am a dad of a 33-year-old son with an intellectual and developmental disability. I advocate with the ARC and have coordinated Special Olympics in our community for the last 20 years. Once the National Family Caregiving Strategy is complete, family and kinship caregivers will be able to access a tool to use to provide improved care and to advocate for family caregiving.
Thank you. Diane Caradu.
I'm Diane Caradu. I'm a retired federal employee from the Centers for Medicare and Medicaid Services and on the Family Caregiver Advisory Council. Once the National Family Caregiver Strategy is complete, family and kinship caregivers will be able to have an effective tool to help them provide the quality and level of care all care recipients need and deserve, while also protecting and supporting the individual caregiver.
Thank you. Patrick Donovan.
Hello, everyone. I'm Patrick Donovan, and I supervise Muskingum County Adult and Child Protective Services Adult Protective Service Unit, also Kinship Unit, and also the Ohio Kinship and Adoption Navigator Program. Also a member of the Supporting Grandparents Raising Grandchildren Council. And once the National Family Caregiving Strategy is complete, family and kinship caregivers will be able to have the recognition and support that families deserve on an even playing field, ensuring that existing programs are more easily attainable while possessing a safety net to ensure that the children in their care have safe, permanent homes, in addition to having the best opportunity for success.
Thank you. Gisela Dolan.
Hi, everyone. I don't know if my camera is working. Can you hear me?
Yes, yes, and we can see you as well. Thank you.
Oh, what? Thank you. It's nice to meet you all and see you all again. Gisela Dolan. I'm Chief Advocacy Officer with Home Instead, and like many of us, I'm also a family caregiver for my mother and my stepfather who has dementia. Once the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to breathe again. Thank you.
Thank you. Gail Engel.
Good afternoon, everyone. My name is Gail Engel. My name is Gail Engel, representing grandparents raising grandchildren in Colorado with the Generations United Voice Network and with the Grandparents Advisory Council member. Once the National Family Caregiver Strategies is complete, family and kinship caregivers will be able to better navigate a system of care services that support their needs while providing a service of care to their families in need.
Thank you. Brenda Gallant.
Good afternoon. Good afternoon. My name is Brenda Gallant, and I'm the State Long-Term Care Ombudsman from Maine. I'm also the Executive Director of the Maine Long-Term Care Ombudsman Program, and I serve on the Family Caregiving Advisory Council. Once the National Family Caregiver Strategy is complete, family and kinship caregivers will be able to access the services and supports they need. In addition, they'll be able to access an evidence-based and culturally sensitive caregiver needs assessment.
Thank you. Catherine Alicia Georges.
I'm Dr. Catherine Alicia Georges, and I'm represented ARP on this Family Advisory Council. I'm a professor and chairperson of the Department of Nursing, Lehman College, City University of New York, and was a caregiver for 14 years for my husband, who had Parkinson's and is now deceased. I see this, that once the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to access and utilize appropriate and trusted services to be able to meet the challenges that they will experience as caregivers.
Thank you. Beth Hoxie. Bet we're going to ask you to unmute.
Oh, there we go. Oh, I'm sorry.
There we go. That's
there
okay.
we go. All right. So I'm Beth Hoxie, and I am a kinship caregiver in Maine. I'm also a member of the Grand Voices and on the National Advisory Kinship Council. And once the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to access freely emotional and financial support without judgment.
Thank you very much. Yvonne Lee.
Good afternoon, everybody. My name is Yvonne Lee. I'm currently a term professor at West Virginia State University in the social work department. And I'm also a therapist that work with at-risk youth that are being housed with grandparents here in the state of West Virginia. Once the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to access the adequate services that they so deserve.
Wonderful. Thank you. Linda Miller. And Linda, I'll ask you to unmute.
I think I am unmuted now. Can you hear me?
Yes, thank you.
Yeah, thank you. So I am Linda Miller, and I am the director of the Department on Aging in the state of Iowa. And I believe once the National Family Caregiving strategy is completed, family and kinship caregivers will be able to, hopefully in the state of Iowa, have access to the services that they need and raise healthy children. And actually our seniors will be able to be safely aged in place.
Thank you. Rhonda Montgomery.
Hello.
Hello.
All right. I'm Rhonda Montgomery, and oops, I think I unstarted my video.
Thank you.
Okay. I am with the Family Caregiver Raise Committee. I'm an emeritus professor from the University of Wisconsin, Milwaukee, and the co-founder of TCare, which is a training and support system for used to support professionals who are assisting family caregivers. Once the family caregiver strategy is completed, and family and kinship caregivers will be able to access the supports that will enable them to actually go through the long journey of caregiving, and do it in a way that provides the care recipient with real care and dignity. And I must add that I've been caring for my husband for 9 years, and we still have a long way to go. Thanks.
Thank you very much. James Murtha.
Thank you so much, Cheryl. I'm James Murtha. I'm a non-federal government member of the Family Caregiver Advisory Council. And it's great to meet you all from the Grandparents Council. And I am a person with a disability, and so I feel a special privilege to be a part of this council as a care recipient. And I'm also a social worker working as a mental health therapist, and I've done some other advocacy work with several other groups. And once this strategy is completed, family and kinship caregivers will be able to take better care of their physical and emotional health, and be able to protect the bonds of family members and maintain strong family relationships.
Thank you. Sharon Olson.
Thank you. My name is Sharon Olson. I am affiliated with the Grand Families of America and Grand Families of Minnesota. I'm on the Grandparent Raising Grandchildren Committee. And once the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to, of course, as everyone is mentioning, access services and information they need, but more importantly, they will realize that they are not alone, and they can become empowered to step forward as advocates. We need lots of voices, and we need continuing voices. I've been raising grandchildren with disabilities for 27 years now, and hope to be able to continue. Thank you.
Thank you very much. Sarah Smalls. Okay, well.
Good afternoon.
Good afternoon.
Good afternoon, everybody. I am Sarah Smalls. I am a kinship caregiver for my 3 grandchildren. I'm also a Generations United Grands member and SGRG Advisory Council member, and a kinship family consultant for a local nonprofit here in Northern Virginia. And once the National Caregiving Strategy is completed, family and kinship caregivers will be able to, as everybody else has said, find and access resources, but I also think they'll feel valued as a community of caregivers, and they can do so with dignity, respect, and appreciation for the services provided. Thank you.
Thank you very much. Charlotte Stevenson.
Hi, this is Charlotte Stevenson. Thank you for giving me this opportunity. I am a grandparent raising a grandchild due to the opioid epidemic. And also, I care for a mother who is 93 and a half with Alzheimer's and dementia. In that case, I'm her primary coordinator for care. I've been serving on the Supporting Grandparents Raising Grandchildren Council, and I'm a new member of the Grand Voices Network. I believe that this national caregiving strategy will raise awareness that there are resources available, resulting in improved access to resources, and that will improve the lives of the caregivers and their families. Thank you.
Thank you very much. Deborah Stone Walls.
Hello, I'm Deborah Stonewalls, Chief of Programs and Services at U.S. Aging and a member of the Raise Family Caregiver Council. Once the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to access the right support at the right time. Thank you.
Thank you very much. Teresa Tenus.
Good day. I'm Teresa Tanis, and I'm a member of the Raise Family Caregiving Council. Once the strategy is completed, caregivers will understand that their role as a competency and their success relies upon integrated infrastructure available within the community. Thank you.
Thank you. Okay. I did have Michelle after Teresa, but I see that Carol Zernial is on. Carol Zernial. Okay, we'll move to Michelle Archuleta.
Hi, everyone. Sorry.
That's okay, no problem. Thank you.
Yes, Michelle Archuleta, Indian Health Service. I am the CHR National Consultant. And once the National Family Caregiving Strategy is complete, family and kinship caregivers will be able to have a living document that reflects shared values.
Wonderful, thank you. Sonia Begay. Okay, you may be on mute. I'm going to ask you to unmute.
Okay, can you hear me now?
Yes, thank you. No problem whatsoever.
Probably saw my mouth a little moving. Well, anyways, I'm sorry. Good afternoon. My name is Sonia Begay. I'm an enrolled member of the Navajo Nation. I am one of the Supporting Grandparents Raising Grandchildren Advisory Council members, and with the Administration for Children and Families, ACF, and then also with the Administration for Native Americans, ANA. Once the National Family Caregiving Strategy is complete, family and kinship caregivers will be assured that they will not be forgotten. Their tireless efforts to keep family together will be recognized, strengthened, and embody the essence of what their place is: compassion for their loved ones. Thank you.
Thank you very much. Katie Capano. Okay, and let's see, Katie, I'll ask you to unmute.
Hello, can you hear me now?
Yes, thank you.
Wonderful. Hello, I'm Katie Capana. I'm with the Food and Drug Administration, and I'm a federal member of the Family Caregiving Advisory Council. When the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to breathe a little easier, being able to leverage the collective strength and wisdom of the community.
Thank you very much. Bruce Fink.
Hello, I'm Bruce Fink with the Indian Health Service and representing IHS on the Family Caregiver Advisory Council. Once the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to to really know that care for their loved one includes care for themselves.
Wonderful, thank you. Jody Sumaraki.
Hi, everybody. I'm Jody Sumaraki. I work at the Centers for Medicare and Medicaid Services in the Disabled and Elderly Health Programs Group. And once the National Family Caregiving Strategy is complete, family and kinship caregivers will be able to have a better sense of the services and supports that are available for individuals and families, and will be able to access those services and support easily. Thank you.
Thank you very much. Liliana Hernandez.
Hi, everyone. I'm Liliana Hernandez with the Children's Bureau in the Administration of Children and Families. And once the National Family Caregiving strategy is complete, family and kinship caregivers will be able to know how to find and access culturally competent services by contacting a kinship navigator who can provide connections to financial and well-being supports necessary to meet the needs of the children that they are raising. Thank you.
Thank you very much. And we have Margaret Cabot.
Hello. Yes, my name is Meg Cabbage, and I'm the VA representative to the Family Caregiver Advisory Council. I'm a senior advisor to the VA Secretary for Families, Caregivers, and Survivors. Once the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to know that they're not alone and also know where to turn for help so that they and their families can thrive.
Wonderful, thank you. Amelia Carricker.
Good afternoon, Amelia Carricker at the National Institute on Aging as part of the National Institutes of Health. I've had the pleasure of serving on the Supporting Grandparents Raising Grandchildren Council. Once the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to see themselves more fully recognized and represented in research that will provide an evidence base to improve their health and well-being.
Thank you very much. Emma Nye.
Hello, I'm Emma Nye. I'm here on behalf of ASFE, the Assistant Secretary for Planning and Evaluations Office. I'm a program analyst there. I've been primarily in the SGRG Council, but also pop in and out of the RAISE Council as well. My hope is that after the strategy is completed, family and kinship caregivers will be able to feel supported by the entire nation. Thank you.
Thank you very much. Jan Newsom.
Hi, I do have some tech issues today, but I'm Jan Newsom. I'm the Senior Program and Partnership Development Specialist at AmeriCorps Seniors at the AmeriCorps Agency. Once the National Family Caregiving Strategy is completed, family and kinship caregivers will become more aware of how to access volunteers who can support their needs in the communities where they grew up and or grew old.
Thank you very much. John Omura.
Good afternoon. Can you see me?
Yes, thank you.
Great. Good afternoon, everyone. My name is John Omura. I'm a medical officer at the Centers for Disease Control and Prevention, specifically on the Alzheimer's disease team within the Healthy Aging branch. And here I am with the RAISE Family Caregiving Advisory Council. So once the National Family Caregiving Strategy is complete, family and kinship caregivers will be able to feel supported in providing care in a way that is both effective and sustainable.
Thank you very much. Rosemary Payne.
Good afternoon. My name is Rosemary Payne, and I am from SAMHSA, the Senior Nurse Consultant, and I serve on the Family Caregivers Council. Once the National Family Caregiving Strategy is complete, family and kinship caregivers will be able to maintain the highest quality of life, both mentally and physically, as defined by the caregiver, while providing high quality support to their care recipients. Thank you.
Thank you very much. Tammy Proctor.
Good afternoon. My name is Tammy Proctor. I'm with the U.S. Department of Education, serving on the SGRG committee. And once the National Family Caregiving Strategy is complete, family and kinship caregivers will be able to access and be knowledgeable of the supports and services they need to successfully care for their family.
Thank you very much. Tammy Proctor.
I think she just went.
I'm sorry. Yes, I'm sorry. Carmen Sanchez.
Hello, I'm Carmen Sanchez. I work in the Office of Special Education Programs at the U.S. Department of Education, and I serve on the SGRG committee. And once the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to get the support they need to lead dignified lives as independently as possible within their communities. Thank you.
Thank you very much. Lisa Schifferly. And Lisa, you may have to. Okay, let's see. Maybe she fell off. We'll come back to her. Atalia Sergi.
Good afternoon and good morning, depending on where you're joining us from today. My name is Natalia Sergi. I am the Director of AmeriCorps Seniors. I represent the federal agency of AmeriCorps on the Grandparents Raising Grandchildren Advisory Council. Once the National Family Caregiver Strategy is complete, family and kinship caregivers will be able to clearly see their needs being acknowledged and addressed by their nation. They will feel secure in knowing that support and resources are accessible to them to care for themselves and their family, and how national service can support their efforts.
Thank you very much. Beverly Yang.
Thank you. Good morning. My name is Beverly Yang.
I'm sorry, Beverly, we're having a hard time hearing you. Are you able to get closer to the mic?
Does this help?
Yes, that helps.
Thank you. I'm Bev Young. I'm with the Consumer Financial Protection Bureau. And once the National Family Caregiving Strategy is complete, family and kinship caregivers will be able to see their experiences reflected in research on the financial impacts of caregiving, have greater access to workplace policies and caregiving support, and also have increased access to age-friendly technology that enables financial caregivers to help protect older adult account holders' assets. I also wanted to say that Lisa Schifferly was having trouble unmuting, but we're on the same team, so I think this helps. This also reflects her work.
Thank you. And she also provided information in the chat for us. Thank you very much. Thank you, everyone. I would just like to ask, I know some members may have logged on once I started. Is there anyone that I missed?
I'm happy to introduce myself. I'm Melissa Gerald, and I'm a proud member of the Raise Family Caregiving Advisory Council. I'm a program director at the National Institutes of Health and the National Institute on Aging. I'm also a caregiver, one of three for my partner's lovely mother, who has a vascular dementia and limited mobility, but great interest in listening in on our meetings here. I'm also the daughter of parents who were the caregivers of my grandmother during the final years of her 101-year life. Once the National Family Caregiving Strategy is complete, family and kinship caregivers of all ages and backgrounds will have access to high quality and appropriate services and supports while preserving their health and their emotional and financial well-being. Thank you.
This is Liz Sweet, and I am from the Substance Abuse and Mental Health Services Administration. I serve on the Grandparents Raising Grandchildren Committee. And once the National Family Caregiving Strategy is completed, family and kinship caregivers will be able to access needed services without having to relinquish custody of their children and without losing Social Security quarters on their record.
Wonderful. Thank you. Did I miss anyone else? If not, I'll turn it back over to you, Greg.
Thank you, Cheryl. And thank you, everyone. As Allison observed in the chat box, what amazingly powerful statements. And when we started this, I know I had invited members of the viewing public to submit some goal statements, and we got some really amazing things that I just want to pull out a couple of them and share for you. Someone says that family and kinship caregivers will be able to enjoy more time as a family member, and I think having been through the caregiving experience myself, sometimes you begin to lose that sense of yourself as a family member, and the tremendous role change that takes place. So really critical. Somebody else said they will be able to care fearlessly. And I thought that was extremely powerful. There is so much fear and uncertainty that oftentimes accompanies the caring role. And so to be able to do that fearlessly speaks to a lot of common themes we heard around access to information, access to services, knowing where to go. The more you know, the better and more empowered you are as a family member to provide that support to the person who needs it. Feel less anxious about financial status later in life. So critical and so true. And we're actually going to be talking about that this afternoon a little bit. And then access to a well-paid workforce, absolutely critical. We hear so much about that nowadays. And so it's absolutely important that in addition to the supports for family caregivers, part of that comes from an adequately and well-trained, well-paid workforce, and that is definitely something that I think we need to consider on the National Family Caregiving Strategy. So thank you for that. Both the comments from the council members as well as what we gathered in the chat are all being collected, and we'll see what winds up in the national strategy, but there are some definite, really good quotable quotes there, so thank you all for that. So we are going to move into the substantive portion of today's meeting, and the first presentation we have are the findings from the stakeholder listening sessions. You probably all remember these amazing ladies, Dr. Pamela Nadash from University of Massachusetts, Boston, Eileen Tell, and Sienna Ruggieri. Earlier in our work together, which is they're working under a grant, a subcontract from the National Academy for State Health Policy, and their grant from the John A. Hartford Foundation. This amazing group of individuals analyzed the request for information data that we received from over 1,600 people. They also convened a series of stakeholder listening sessions that really dug into some of the input that we received on the RFI. And their next phase of the work that they've completed is convening a series of stakeholder listening sessions. And you're going to see here in a minute, as council members, you're going to have just an absolute treasure trove of information that they gathered from these stakeholder listening sessions that will really truly inform your work to develop the National Family Caregiving Strategy. So with that, I am going to turn the floor over to Dr. Nadash, Eileen Tell, and Sienna Ruggieri, so you all can take it away.
Thank you. Are we visible?
Yes, you are.
We are. Okay. Great. Well, I'm going to kick things off. Good afternoon, good morning, aloha, depending on where you are. I'm really pleased to be here today with my colleagues to share with you the findings from our more than 160 hours of conversation that we've convened over the past year with a wide range of stakeholder groups working with family caregivers. Anybody who wants to listen to those 160 hours or read the transcripts is welcome to. But first, I just wanted to thank the RAISE Advisory Council staff and faculty, NASHB, and the Hartford Foundation for giving us this really important opportunity and allowing us to be a part of this process. It's truly been an honor. We're grateful for the guidance and the support that has been provided along the way. And it's not often that you do work that is so truly moving and that makes you cry, but in a good way, and with such really fabulous people who's, as we've just seen from all the things you guys have said, working on such heartfelt and important work. So it's truly been a pleasure. So let's dive right in. Can you do the next slide, please? So I'm going to start off describing the research design and the methodology that we used. My colleague, Sienna Ruggieri, is going to talk about the outreach strategy that we used to identify the stakeholder organizations and which ones actually participated. And then finally, Emna Dash is going to delve into the findings, and she's going to walk us through the recommendations for implementation that emerged from all of these meetings. They're organized by the 5 primary RAISE goals and the recommendations within those, and they're differentiated by actions that can be taken by federal entities and then those that are suitable for state, local, and private sector entities. And when you delve more into the reports that have been provided, you'll see that we tried to get the groups to get as specific as possible about who owns what action and what might it take to get that action to move forward. Okay, so the next slide. The objective of all the research activities this past year was really to help shape a roadmap for the national strategy. As we explored with stakeholders what they felt should be the priority action areas, we did focus on some of the critical topics that emerged from phase 1. The consumer focus groups, as well as the RFI analysis from phase 1. Sorry, I'm getting a message on my screen that says to turn off my spotlight. Is anyone else seeing that, or is it just to me? Anyway,
no, you are fine.
Okay, all right. I just want to make sure it's not disrupting any visuals. Sorry. Okay. So, so we identified the, in addition to the goals and recommendations, we also wanted to focus on some of the critical topics that came up from the consumer focus groups and the RFI analysis, the things that consumers were really concerned about and the stakeholder groups that work with them. And so these are listed here, raising awareness on issues around family caregiving and helping family caregivers gain the tools they needed to identify themselves as family caregivers and help them get access to information and services that they needed to meet their obligations and their needs. Meeting the needs of culturally and ethnically diverse caregivers. Identifying solution and supports for working caregivers, and this was a big area of our focus, as you'll see. Expanding the availability and use of respite care. Addressing the needs that family caregivers identified for training, self-assessment and support, just meeting their own needs. And then making them better caregivers, if you will. And understanding how to better integrate and support caregivers into the healthcare system, beginning from hospitalization, discharge, aftercare, making sure that physicians, healthcare providers know who the family caregiver is and integrate them, a challenge that was even more heightened during the COVID, as everything is. Next slide, please. So the work took place in 2 primary components. Phase 1 was a series of stakeholder strategy sessions that were really organized around each of the 5 RAISE goals and recommendations. And phase 2 included both one-on-one key informant interviews and a series of stakeholder listening sessions. And it probably goes without saying that all of this was conducted over Zoom. Everything had been planned that way, except for the December stakeholder sessions in 2020 had been intended to be in person, but we pivoted quite easily to do them over Zoom. So the next slide, please. For phase 1, Sienna will talk more about how we did outreach and who participated in those stakeholder sessions. We convened important organizations, largely at the national level, who could really guide thinking around issues that were relevant to implementation of the RAISE goals. This includes organizations representing caregiver issues from various perspectives, including aging, disability, provider groups, research, academia, advocacy, and others. Of the 60 organizations invited, 42 participated, and there were 6 two-hour sessions held the second week of December in 2020. Next slide, please. The objectives of those meetings were to engage those key organizations in the work of the council, ask them to begin to brainstorm the kinds of action steps that could address each of those 5 major goals, and to bring them into the fold when we got to the point later on of getting to what would it take, what's more involved in implementation down the road. And a lot of the information from those sessions was folded into the discussion guides for the next phase of the work. So the next slide, please. In phase 2, the objective was to delve deeper into some of these ideas that emerged. One good example was the phase 1 group came up with the idea of an awareness campaign. And then we talked much more about that in phase 2, and how that could be something that would be rolled out. And to generate additional insight on some of the concrete actions that could be implemented by a variety of actors and bring more life to the goals and recommendations. We started out, we had a 2-tier approach to selecting participants. We started out by identifying key informants, people that we knew were thought leaders on the various topics that we wanted to explore, to both help us identify what the key discussion points for the listening session should be, and also who would be the most knowledgeable and diverse group of participants we could include in those sessions. We wanted different-minded thinkers, people from different perspectives, and we wanted people who could speak well to the topics included. So we did 17 key informant interviews, and each was about 1 hour over Zoom. The next slide, please. The stakeholder sessions took place mostly in October of 2020. And in the next slide, I'll show you how they were organized by topic. Each was 90 minutes and had about 6 or 8 participants. And we conducted 16 of those sessions, and we heard from about 103 different organizations. And then on the last slide, and what I'm going to talk about is a high-level work plan. The appendix will show you this same work plan, but it builds out and shows you the actual research question, summary of the research questions that we were looking to explore within each of these domains. So the summary here shows the selection of participants, the type of either participant or topic we were looking to explore. And you see here, and the number of groups that we did with each. So we were focusing on employers to understand the workplace financial and impacts on caregivers, and what could be done to help support and sustain working family caregivers, the availability of respite care, the integration of family caregivers into the direct care healthcare experience during and after discharge. So we focused on that, the direct care workforce, and building that out and enhancing availability and access and supply of direct care workers. Counties, understanding the role that counties play as providers of care and information or referral. And then looking at community-based and faith-based organizations, and also ethnically and culturally diverse populations and how their needs could be best met. So now I'm going to turn things over to Sienna and the next slide to tell you how we did our recruiting and who participated. there any questions before I move on? Greg, I meant to say, we'd like to save questions for the end, and we've allocated about 20 minutes for that, or 15. But if there are any questions that are really holding people up, particularly as Pam gets into the findings, go ahead and either put them in the chat and tell Greg, I need this answered before I can go on, or raise your hand, I suppose. Does that work for you, Greg?
That's fine. And I just wanted to let everyone know that because there have been a couple of questions about this, a recording, this meeting is being recorded, and the recording will be posted within the next couple of weeks, along with all of the presentation materials that you see here. So you will have access to the recorded presentations as well as to the PowerPoint and all the information that's on them. So stay tuned for that.
Great. Okay. Take it away, Sienna.
Hi, everyone. My name is Sienna Ruggieri. I'm a program and policy coordinator with Community Catalyst, and I worked with Pam and Eileen on this research. So just to share some more information about how we reached out to a diverse and varied group of stakeholders. In doing this research, we sought to connect with a diverse group of stakeholders to ensure our findings were adequately representative of the state of family caregiving across the country. And in order to achieve this goal, we recruited a broad range of organizations to participate in key informant interviews and listening sessions. Our priority specifically for this phase of the research was to engage organizations that were not previously connected with or familiar with the work of the RAISE Council. How we went about this, we looked at organizations participating in existing coalitions. We looked through existing publications, webinars, and awareness campaigns. And we also did some geographically based location-specific searches of caregiving organizations that were active in the area. And then we reached out directly to individuals at organizations of interest and asked them to participate in a listening session or a key informant interview based on their area of expertise. If we can hop to the next slide, thank you. It's difficult to capture the broad spectrum of stakeholders that were represented in our research, but the next few slides do include the names of all the organizations we connected with. If you can just go back one, thank you. This list includes national advocates, state and local advocates, employers, researchers, faith leaders, foundations, direct service providers, parent information centers, municipal, county, and state government officials, health systems, health providers, caregiver resource centers, business leaders, and coalitions. Next slide, please. The organizations represented in this list come from a wide variety of geographic contexts, and they represent 37 states. The organizations span from a family caregiver resource center serving parents of children with disabilities in rural Montana, a respite care provider in Honolulu, a memory disorder support organization in the Big Bend area of Florida, and a health systems family caregiver program in Detroit, just to give a few examples. We could move to the next slide, please. The organizations we spoke with also represent a diversity of family caregivers. We spoke to representatives of the disability and aging communities, as well as organizations supporting kinship families. We dedicated listening sessions to specific populations of family caregivers, including Indigenous and rural caregivers, as well as caregivers who find support in their faith communities. We intentionally sought out organizations that work with communities of color. To give you a few examples, we spoke with a Michigan home care agency that specializes in the elderly South Asian community, a grassroots partnership supporting caregivers in Latinx and African American communities in the south and western suburbs of Chicago, and a Research Institute's Arizona-based Native American outreach program. We can move to the next slide, please. In addition to bringing a diverse representation of family caregiver lived experiences, we also connected with sectors who are invested in family caregivers in other ways. So we had dedicated listening sessions to speaking with employers, experts in the direct care workforce, health systems, respite providers, as well as county officials. Next slide, please. And in many of the listening sessions, organizations had not connected with one another before, and in many instances were excited to engage with other caregiving stakeholders. The listening sessions gave many organizations an unusual opportunity to connect with other stakeholders passionate about supporting family caregivers and those they care for. And in addition to our research findings, these listening sessions illuminated the importance of dedicated spaces for caregiving stakeholders to connect, exchange insights, and collaborate. Our research sought to bring more stakeholders into the RAISE Council's conversation, and I think the rich findings illustrate the importance of connecting with a diverse array of stakeholders. Our entire research team is incredibly grateful to each and every organization who shared their time and insights. I see a few folks here today and just want to extend our thanks again for giving us the time and attention to these listening sessions. That's all I have to share. I'm going to go ahead and pass it off to Pam, unless there are any questions at the moment.
Were there any brief questions? If not, we'll move to Pam and then save questions at the end. Great. I think, Pam, you're up.
Okay. I'm here, but I don't see my video showing. Is it showing yet?
Yes, it is. We can see and hear you.
Great. All right. Thank you so much. My name is Pamela Nadash, and I am an associate professor at University of Massachusetts, Boston. I just want to kind of just say what an amazing job Sienna did in pulling together and keeping track of all those people. You can imagine what an incredible administrative task it was. Reaching out to so many people and assigning them to the right group and keeping on track and everything. So Sienna just did an amazing job. Okay, so now I'm going to talk about all the material that we collected through this outreach. And as Eileen said, hours and hours of focus group and interview content that we had to pull together and organize. And if anyone is at all acquainted with academic research, you know that there's a way to do everything the right way. And so we used a software program called NVivo, which allows us to just organize the material so that we can very systematically group it into content areas and then go through it and think through our findings. As you can imagine, it was a lot of material and it was a lot of work organizing it into categories. And we all worked together as a team to do that. There were 4 of us who were all involved in this work. And so now we've got all this material organized. And, it was done very carefully. We all tried to make sure that we were doing everything very consistently and weren't missing anything major. Okay, next slide, please. All right, so now I'm going to talk through the findings. I just want to sort of start out with a few caveats. As I said, there was an enormous amount of material that we had. So what we're going to be showing to you are really the highlights. We thinned down the findings and tried to focus on the most important ones, which are fully presented in the report that we've submitted, but also summarized in these slides. So just be aware that what's presented in these slides is a summary of what the findings were. And I also just kind of want to just make sure you're aware. We went through, how the first stage differed from the second stage. And the main thing you just need to remember is that the first stage was the stakeholder sessions in last December were organized around goals, whereas the second part was organized around groups. So that means that certain topics weren't addressed. That doesn't mean that those topics were not important or that those topics didn't need to be thought about. It really was just that because of how we did things and the very limited, nature of, a 90-minute conversation, that some topics just didn't get covered very well. So just kind of remember that when you go through this and you say, oh, something might be missing. It might be missing because it's in the fuller report, or it might be missing because we didn't address it. All right, next slide, please. Okay, so the first set of findings are really around goal number. We organized our findings around the goals, and what we did was we separated them out into actions that were for the federal government and actions that were for non-federal players. So it's simply because the ACL works at the federal level and can organize certain types of activities. And so there are the federal actions that can be done in a coordinated sort of way. And there are other actions that need to be taken up by other entities, such as, states, not-for-profit organizations, and in other private sector actors. So these are organized according to those categories. And the first big theme that ran through the findings around Goal 1 were, of course, around this awareness campaign idea. And you can see that reflected at both levels. Firstly, that the federal level has to promote an interagency awareness campaign, and that the states and other local entities need to support that with their own state-based kinds of approaches. And that this isn't just about an awareness campaign, it's also about creating resources that can be used to highlight awareness and to bring people who don't identify as family caregivers into the fold. So some of these action items incorporate those resources. Now, one of the key resources was a national website and help desk. People talk about how the sorts of centralized resources that should be available should be improved upon, and that some of these resources, we need to think very carefully about them being culturally relevant. Another big theme was around state plans on aging. And of course, the model for this is, what California did. People talked about California a lot, but a lot of other states have developed state plans on aging. And so to incorporate family caregivers into that, it was a big theme that if there were this mechanism available, that could be done. And then another really important theme throughout is that special efforts need to be made to reach excluded groups. So as I think both Eileen and Sienna talked about a lot about, we really did focus on trying to think how we can serve excluded populations better. And so a lot of conversation was around what needs to be done in order to do that. So obviously, we need to promote better access to culturally relevant materials, but also that there really needed to be special efforts focused at folding in excluded groups. And so there was this like a community ambassador idea that states should organize systems of community ambassadors that would involve people from those groups who would act as liaisons or ambassadors, and to connect family caregivers in those groups with the resources that are available. Another really big thing was that this awareness campaign should not be generic, that we really need to focus the awareness campaign on specific target groups. And that two of these, the most important target groups, we're going to talk about this more later, is the employers and also healthcare and LTSS providers, so service providers, because the kind of information that those groups need is going to be different from the kind of information that the general public needs. Okay, next slide, please. So here we have a few of the quotes. Throughout this presentation, we have a lot of quotes, and I'll let you pause and read through those a little bit. I think we had so many wonderful quotes that people things that people said that I just wish all of you could look at and read through because they were so rich and so interesting. And I love this one about the sense of shame that might prevent people from reaching out and trying to get support. And also the fact that that's culturally conditioned and we need to be sensitive to that. Okay, next slide, please. Yeah, and then there was, you know, a lot of talk about how frustrated people were that there were resources available, but that people didn't know how to connect to them. And I'm sure that's a thought that all of you can relate to a lot. Okay, next slide, please. All right, so this goal was around working how family caregivers can be folded into the healthcare system and systems of LTSS better. So we had this continues really on the theme of the need to identify family caregivers and to get them to self-identify. So one of the sort of interesting things that echoed throughout a lot of the conversations was this idea that people don't know they're caregivers. We've all heard that before, but that it was hard for service providers to quickly identify somebody as a family caregiver. Because if you ask them, are you a family caregiver? Some of them will look at you with a blank face. So this idea of creating a very quick kind of, you know, like the mini mental, something really quick to administer that would enable people to identify somebody as a family caregiver in, you know, the emergency department or some other kind of setting like that. So that was one sort of idea that came up. Yeah, there was a lot of endorsement for driving the increased use of caregiver assessments. So one of the really important things was to think about systems for including family caregivers into these different settings. We were talking a lot about hospital settings, but this translates to other types of settings as well. And so these systems are things like the CARE Act. So there were specific recommendations that states should either adopt if they haven't or expand the CARE Act, because that's a systematic way of ensuring inclusion of family caregivers, but also the more systematic exploration of incorporating caregiver assessments. But another key component was to ensure that there are incentives for people to engage with family caregivers. So you see that at a few points on this slide. So both in terms of private payers, that is insurers or health systems, to create financial incentives for providers to engage with family caregivers, but also the idea that the Medicare program, for example, could create reimbursement codes to enable providers to engage more closely with family caregivers. So there are things like that. There was also a lot of conversation here about the fact that physicians, clinicians of every description, and service providers of various descriptions, including people working in LTSS, don't really understand family caregivers. And they don't understand that there needed to be more education and outreach so that people understand what's going on with family caregivers. So I think I'll whiz along. Let's look at the next slide. We have some quotes. All right. Yeah, so there was a lot of, a few mentions of physicians being reimbursed. So I think that last quote there, as a nurse by training, I never formally learned how to assess family caregiver needs. So this is all kind of reinforcing, you know, what people were saying, that, you know, people don't really understand what's going on with family caregivers or the role that family caregivers can play in maintaining the health and well-being of care recipients. Okay, next slide. Here we go. And the creating incentives thing was a big deal. All right, thank you. So goal 3 was around this. Goal 3 was the mammoth one, if you recall. There are 9 recommendations in goal 3, and they were all about expanding access to the services, supports that family caregivers need. So there were so many recommendations here. I'm going to try to whiz through them. A lot of the big picture ones were all about improving the HCBS systems and all these other programs at the federal level, expanding all these programs that serve family caregivers. So that's fairly straightforward. But then there were a lot of things that could be done at the state and local level to basically improve access. And again, there are a lot of issues there. I think one of the key things that came out was the need to support these smaller groups that receive that serve specific populations. That it can be hard to maintain those groups, but those are the groups that maintain connections to these underserved groups. Once again, there was a repeated interest in a state master plan. Okay, next slide, please. Okay, so expanding access to broadband came up a lot because, again, when we talk to people who lived in rural areas or talk to people, for example, Native Americans who live in very rural areas, these were all critical parts of getting access to mainstream supports. And then there was an enormous amount around direct care. We had a lot of conversations with people around the need for reliable, a strong direct care workforce. And so there are a lot of specific recommendations came down to supporting that workforce, both at the federal level and at the local level. The state Medicaid agencies had to make sure that there were ways of making sure that people got better pay. Paying family caregivers came up a lot as well. I know you guys probably remember the RFI, that was a key demand of family caregivers themselves, but this also came up in terms of expanding the workforce. So there were a lot of recommendations that spoke directly to the direct care workforce. Okay. Oh, and then respite as well. We all know that respite is a huge area, and there was a lot of conversation around what specifically could be done to support respite. Okay, next slide. So some of these quotes, I think, talk about how weary people were of all this, that we've all acknowledged the direct care workforce crisis, service crisis, and nothing's been done. And that we really need to wrap our heads around this. Okay, next slide. Yeah. All right, next slide, please. Okay, so this next one has to do with supporting family caregivers' financial needs. And so again, there was a huge amount on this, people talking about what was needed for financial security. And again, some of these are not at all surprising, demands to expand FMLA and other forms of paid family leave. Again, increase access to programs that pay family caregivers, but also other kinds of tax reliefs for family caregivers. And then there was a lot of talk around how do we get employers to be more caregiver friendly? And so one of the ideas was to create actual incentives for that. Which could incorporate some kinds of tax incentives. But there were also ideas around voluntary certification programs, just like we have age-friendly universities, we can have caregiver-friendly workplaces. And then, of course, the big one, if LTSS were more affordable and available, then that would be a big worry off the backs of family caregivers. Okay, so one of the things you should also notice is that there are the federal actions and then there's the non-federal actions. And a lot of these are targeted specifically to employers, because one of the big things we heard was that employers listen to employers. They don't want to be told what to do by government. So a lot of the local ones would really need to be taken up. Employers would need to be the players. And one of the models for this was the Massachusetts Caregiver Coalition, which is a coalition of employers who are thinking about ways to make workplaces more caregiver friendly. Okay, and that there was this idea of a national campaign to encourage employers to become more caregiver friendly. Okay, next slide. Okay, so here we go. Lots more quotes about this. Yeah, there was the expansion of FMLA really, I think grandparents here would appreciate, that we really need to expand the definition of what a caregiver is. And that was really endorsed. Okay, next slide. Now, the last goal was around data and research. So, I'll just kind of briefly summarize these by talking about, firstly, there's kind of a federal role to coordinate and support research and demonstrations and to promote standardization of certain data items. And then there are also, key focus areas that people talked a lot about. One of the most important ones that we heard from a lot was the importance of proving that it's worth it to employers to provide caregiver friendly supports and to be caregiver friendly. What is the return on investment of being a caregiver friendly employer? We really need data to back that up. We also heard a lot about how poor the data is around the direct care workforce. And again, we need more standardized data on that, as well as research around the direct care workforce. And also people talked a lot about best practices in a whole load of different areas, including caregiver assessments, and especially the CARE Act, that it was felt like we really don't understand how we can get hospital systems to incorporate not just the provisions of the CARE Act, but also more generally practices around incorporating family caregivers into hospital care and other forms of, the healthcare and LTSS system. Okay, slide, please. Next slide. Okay. All right. I think I've done it exactly in time. I'm really proud of myself. That was a lot of stuff to get through. All right. So would anyone like to, I think we can move into the questions.
Sure. Thank you. You guys are amazing. Council members, this work, you all will be the direct recipients of all of this great information gathering done by Dr. Nadash and colleagues and through NASHP. And this will all become part of the basis of the work, the deliberations that you have in the coming months as you begin to start to finalize the actions on the national strategy. So I wanted to just open this up for questions of the three presenters we just heard from.
Would you like us to return to screen and the world of speaking?
Sure, yes.
Okay.
Any questions from council members?
Shannon, do you want to, oh, there you go. Okay.
Gail.
I just have to say, I find it very interesting that caregivers not only see themselves as non-caregivers, just family, but our community also doesn't recognize us as caregivers. They think we're just family doing what we need to do, especially when it comes to child welfare.
I think it's a combination of the actual phrase caregiver, that some people just see it as I'm just a daughter-in-law, and some people, if you just ask the question, like they know they're doing caregiving, but if you just ask the question, are you a caregiver, that phrase doesn't resonate if you're trying to do any kind of research or outreach, or identification for the purposes of serving people. It's not that they don't think they're doing it. They identify by the tasks that they're doing. It's like when we did the recruitment for the focus groups for the family caregivers, we had to ask the question in terms of, are you doing any of the following for someone like X, Y, and Z? And then people would, identify themselves. But But if we just said, are you a family caregiver? You know, A, we would have gotten people that are parents, you know, just parenting. And B, they might not have known what we were talking about. Does that make sense as an answer?
It really wasn't a question I was asking.
Oh, sorry.
Because I am here raising my grandchild, and I see this all the time. And as a kinship care provider, I don't necessarily see myself as a caregiver, but I'm often observed by child welfare and schools that I'm not a caregiver. I'm just family, and I should be doing
Oh, I see. Okay. I didn't think of the flip side, but you're right. That makes good sense. And that's probably an important part of the awareness campaign, is to let the rest of the world know that these people are valued and valuable. And that's why I think some of the literature I've seen out of the committee on the cost of, if these people, if the unpaid family caregivers were out of the picture, what would the cost to the system be, is a really important message.
Casey?
Thank you so much for that incredible set of presentations. Eileen, I'd like to go back to something that you shared in your presentation that Gail actually just touched on as well. And that is the idea of developing an evidence-based assessment tool for being able to do that assessment during primary care visits, during social service visits, during any time that there's interaction with the health system or with services, that we could move toward having something like the MMSE, where we use that in, long-term care and home health and post-acute settings and care of older adults very systematically. That's part of our work as clinicians. And so I would love to hear your thoughts about the ability and the timeliness for us to really move toward creating that kind of a comprehensive evidence-based assessment tool that could help us assess the needs for family caregivers, but then also raise that visibility and that awareness in those who are providing the care of their status as a family caregiver.
Right. I think that came up in Pam's presentation, but I think that'd be great to do more brainstorming on how to do that. And we did provide some. In the report, there are some best practice models that some people volunteered in the sessions of where there are tools that exist. So we need to do a lot more research on implementing some of these. I think there are two pieces to it, and then I'm going to let Pam, because I think she has some things to say. There is first some really simple questions that healthcare providers can ask to just identify, are you taking care of somebody? When I go to the doctor, my gynecologist, OBGYN, always asks, am I sexually active, and am I in an abusive relationship? Because that has important impacts on my health and safety. I don't know if they're required to by law, but they always do. And why doesn't my primary care doctor ask me if I am a family caregiver? Because that has implications on my health and stress and mental health and whatnot. So just even knowing that should be part of my health record. And then the second part is, where are you in the stress zone? And I know the work of T-Care at assessing family caregiver stress, and Archangels was a program we talked to, where they have a really easy online tool to see how sort of hot you are. You come out with a temperature score, and it's like maybe 10 question online tool. So I think there are things, and I don't know how evidence-based that one is, but so Pam, did you want to add anything? Sienna? You're on mute. Sorry.
Yeah, I just want to make sure that people are clear that, there are all these different terms being thrown around now. So when we talk about caregiver assessment, there's sort of that idea of a sort of comprehensive assessment that helps people to identify the services that they as family caregivers need. And there was a lot, I kind of skimmed over it in my presentation, but, people really, there's a lot of research that needs to happen around that, not only what the best tool is, but how do we systematically incorporate this into the healthcare system, so that people use it, they know it happens. So that's kind of one thing. And then there's this other sort of thing that we're talking about, which is basically, somebody shows up at the ER and, there's an older person and there's this person they're with, and that person they're with, even the triage nurse should be able to quickly identify this is the person who provides the meds all the time, and I need to be educating this person and asking them questions. That needs to be systematized. It happens on a very haphazard basis, and that is an opportunity there. And then there's the other stuff Eileen was talking about, which is other kinds of tools that can be very helpful.
Great, thank you, Alan.
Thank you for this for these presentations. An enormous amount of information, impressively presented. So thank you all for such a comprehensive job. And I guess I'm fascinated by so much of what you have presented, and want to make, I guess, a comment of I did notice this going through what I think are some cross-cutting issues, particularly around. I'm gonna throw it in the bucket of financial issues, and from the caregiver side of how do we demonstrate tangible supports, a number of issues related to tax credits and such. But going back to Casey's previous question, what are the ways that we can incentivize, again, dealing with the kind of financial lever of change, incentivize the systematic changes we need to see in businesses, healthcare, perhaps even down to county governments, because I really like the emphasis on county governments that was mentioned. Any additional ideas other than tax credits, which would go probably directly to caregivers themselves? How do we incentivize change at the system level?
Well, I mean, there are no easy answers to that one, of course. But I mean, I think with respect to the healthcare system, there were very specific recommendations about adding in, billing codes and, and things like that. And those, if not easy to achieve, are fairly straightforward conceptually. Just like we obtained the end of life counseling under the Medicare. In the Medicare program, you can imagine, caregiving counseling or something like that being incorporated more systematically into the Medicare program, or, people were talking about insurance plans as well. So that's kind of one very specific incentive. The other sorts of things I think are more legislative. So.
And it links back to the research, because if you demonstrate to the health plan that you're going to reduce rehospitalization by having this reimbursement code that incentivizes the provider to take time with the caregiver, then you have a better chance of expanding the reimbursement, because it's going to return to them in the form of lower costs or avoiding penalties or whatever. So, the research has to prove that the expansion of dollars pays for itself to some extent.
A couple of other pieces that get us closer to an answer to that question. We also, cross-cutting theme that came up was direct payments to family caregivers. There are states doing that, and some folks in listening sessions spoke to their experiences of that. And also our conversations with employers. We found a lot of insights in that sector of business leaders, employers who recognize the value of supporting family caregivers and initiating that culture shift in the workplace. There'll be more specific details in the report, but those are two general themes we noticed.
Thank you very much.
Okay. Jaya.
Thank you. Great discussion. I wanted to spend a little bit of time talking about trust. We see incredible value in when it comes to grand families and kinship families at peer-to-peer supports, recognizing that there's a special trust that happens when somebody who's been there is delivering the service. And we know some of the best services could be available, but if the family doesn't trust to reach out and use them because of who's delivering them, they're not going to be effective. So I wondered if you could speak a bit more to themes that came out around trust across family caregivers and any recommendations to address that. Thank you.
I mean, the thing I think about most when I think about that was all these conversations, I talk about excluded groups, but what I'm trying to cover is, I think Sienna described very carefully how we reached out to groups that are not well connected to the mainstream. And part of that has to do with trust, right? And whether it's an Asian American community or a South Indian family or whatever, it's about not feeling comfortable in that kind of environment. And that's why this kind of community ambassador idea, which is modeled on HIV prevention and the Ryan White, there's a specific model for that that did come up in the conversations. This has been done before and it could be done again, which involves, somebody from a given community being the trusted supplier of information and advice, and it happens informally in many cases, but it could be systematized and strengthened and supported. So
yeah, I don't know if you want to talk about some of the groups with faith-based organizations, but that was a strength that they had, is that they were a trusted source of information and like-minded people getting to give sort of a peer-to-peer group, and they had a lot of good work with that. And they found, except for the problems with broadband access, they found that moving to electronic platforms and Zoom support and whatnot worked really well for some of their caregiver programs, because people could more expeditiously participate than maybe they did when they had them, more limited times or required driving or whatnot. So.
Okay, we have, in order to stay on our schedule, we've got time for just 2 more questions. So Sharon?
Thank you. I'm in no way trying to disregard the general caregiving subject, because I was caring for my mother for the last 4 years in addition to raising grandchildren. But I'm just not feeling enough recognition for the issues of actually the grandparents that are raising grandchildren. There's a positive attitude toward somebody taking care of an elderly parent, that type of thing. But more often than not, grandparents and other relatives that are raising relative children tend to still end up staying under the radar, maybe not being acknowledged, because there's a negative that comes with what we're doing. And we're fighting that all the time, whether it be with social services or just general attitude of the public. And I really would like to see more emphasis on a positive attitude toward what we are doing and what we've, I hate to say given up, because we have lots of rewards with raising the children. I appreciate that this council has included actual relative caregivers, because we are in the trenches. So I really want to say I appreciate being able to participate in this. But there's so many things that impact us that we don't even think about ahead of time. And during the introductions, one of the last people speaking, and I didn't catch the name, had mentioned credits being able to be accessed, not just tax, but actual credits on a work history. When I ended up retiring, even though I'd had to give up my job much earlier on to care for the children, they had huge disabilities. I was not contributing in any type of tax credits. So when I retired, I had to retire at the very lowest rate possible. And so if there was some emphasis or research, something addressing that, that would be most helpful for our elderly caregivers, such as I am. But I just, again, not taking away anything from regular, caregiving for the general, what we think of as caregiving, but the grandparents that are raising grandchildren, there's just another layer of negativity that goes along with what we're doing. And I just really feel like I'd like to hear more addressing that in these various studies and reports. Thank you.
I think, for the first stage of our research, when we did the RFI analysis and the focus groups with family caregivers, we covered that came out really strongly. I think the Social Security deductions is something that a lot of people have supported, but it didn't come out. I said at the beginning that certain topics just weren't really that discussed, and that was one of the ones that wasn't really discussed in this stage of the research. And, like I said, it's like, it's not that it wasn't important. It's just that it didn't come up, so I apologize for that. And there was a lot of recognition of the fact that the FMLA was very limited in terms of, who was incorporated into it. And like I said, in our early stage of research, people talked about this a lot.
Right. I think also, and not to diminish the value of the comments you're making at all, but this research phase was specifically designed to not for the grandparent population, grandparents raising grandchildren, but for the raised family caregiver population. If we had broader research goals, we would have reached different stakeholders and included them in the research, and the issues you're describing absolutely would have emerged like they did in the first phase. We did do some focus group with Generations United, and we heard those issues, and they would have emerged. So it was just a question of, not that they're not important at all, but that's not the population we were talking to. So they didn't have it, and not because they're not important, but because they weren't a part of the project's focus. But they should be the focus of research for sure. I don't know if I said it. I didn't say it as well as you could, Greg, I'm sure.
No, that's I mean, this was your work that you all did, Pam and Eileen, was under a subcontract from the National Academy for State Health Policy. They were funded by the John A. Hartford to specifically support the work of the RAISE Council, and so we had to keep things within the scope of that focus. Yet we fully recognize that so many of these issues reach across to the kinship and grandparent populations, and so I think we will have the opportunity within the development of the national strategy to begin to actually tailor some of the specific actions to be able to speak to this particular population. We have time for one more question, Rhonda, and then we are going to take a quick break. So Rhonda?
Yes, just a real quick one. A couple people back, it was brought up for getting Medicare or people to pay for counseling for caregivers. And it brought me back to something that I've kind of harped on for a long time, but now experiencing it, I really want to bring it to highlight. The poster child for this should be hospice. Hospice totally includes the family and considers the family in the care plan. And having moved through a lot, I am so relieved now that we are dealing with hospice, even though that means something different, because the support is way more than any other I have had. And I think we should be looking for that because Medicare pays for that. And how can we build on that?
I think somebody even mentioned that. I have to look back and see when we talked about practice models. But
yeah, in our provider session, someone described how the hospice model functions and how it would be really helpful to see how that could be retrofitted for family caregivers more generally. So we identify some, that as part of a report, identify some best practices, some promising models, and hospice definitely emerged. In addition to the HIV community, there's some promising models out there that we really think have a lot of potential to be applied more broadly to family caregivers.
Thank you for that, Robin.
Thank you all. So in order to keep on schedule, we're going to go ahead and take about a 5-minute quick break, just to give folks a chance to get up and stretch. And then we're going to come back right around 5 to 3 Eastern time. And we're going to hear from another panel focusing on caregivers in the workplace, as well as financial security and preparedness. So we're going to go on break for just about 4 to 5 minutes, come back right at 3:55 or 2:55 Eastern time, and we will conclude the rest of today's meeting. Thanks. Okay, everyone, let's go ahead and resume. Hopefully that break was enough to give folks an opportunity to at least stand up, walk around, pet the dog, whatever. But we've got, and I want to extend my my just considerable thanks to Pam, Nadash, Eileen, and Sienna, and their work with NASHP. This is proving to be your ability to analyze the information that has been collected, to work with the broad groups of stakeholders, is exactly the type of and level of detail that the council members will need as they begin their work on the National Family Caregiving Strategy. I should also note that the report that will be a much more detailed version of the presentation that you saw, which will greatly inform the council members' deliberations, but also be made available to the public. Wendy, if I'm not mistaken, it's going through some final clearance and review there at NASHP, but it will be made public, and we'll disseminate that information pretty widely.
Yes, Greg, and in fact, UMass Boston and Community Catalyst is prepping that, and they're publishing it, and we will let everybody know when it becomes available. And we're thrilled about the interest.
Sounds great. Thank you. Okay, so we have another information-packed panel presentation. There's a couple of issues that we haven't really spent a ton of time delving into, and that is the issue of family caregiver employment, financial preparedness, and things like that. So we have 3 really great presentations that will make up a panel. One on just caregivers in the workplace and working while caring, and Dr. Jennifer Olson from the Rosalind Carter Institute will talk about some research that they've done in that area. Then we're going to hear from Greg Olson with the New York State Office on Aging, and that state's employer and caregiver campaign that they undertook. And then we're going to hear from the Alzheimer's Association, who's just winding up a 3-year project that ACL funded out of my office to really begin to look at providing tools and supports to really bolster the financial literacy and preparedness of family caregivers. So each will do their presentation, and then we will wrap up with some questions at the end before we move into the final session of our meeting. So Dr. Olson, can I turn it over to you? There she is. Okay, great.
Hi, Greg, thank you. And thank you all for having a conversation with us today about we call working while caring. This effort is inspired by Mrs. Carter's dedication to moving caregiving from the margins of society to the middle of our collective focus. And so this initiative that I'll speak about in our research looks at people who are what we call working a double or sometimes a triple in a variety of roles, and looking at that point of intersection. We've been hearing in the news about the Great Resignation, the Great Reassessment, and how industries are struggling to deal with people leaving the workforce for a variety of reasons, hiring challenges, and how to keep employees. And so I think this is actually a great time to think about how supporting caregivers can be part of all of the shifts and changes happening at the employer intersection. Next slide. Just a brief overview for those who may not know, the RCI, formerly known as the Rosalind Carter Institute for Caregiving, we shifted our focus and our name about 1.5 years ago to put caregivers at the center of our work, and you'll hear that throughout the research that I share. We see caregiving as a public health issue, so those who know the public health pyramid will find this a familiar approach to thinking about how we want to support as many caregivers as early in their stage as possible at the bottom or at the earliest point at that awareness stage, and then provide more intensive or secondary and tertiary supports as needs arise. Next slide. So we did 2 national surveys and shared these results. I'll put the link in the chat for a pretty in-depth set of slides for people to look at, but we shared these in the fall. 2 surveys that look at the pain points for caregivers that are holding full-time jobs. And so you see here that 1 in 5 employees are caregivers, and this was full-time workers looking over the past 2 years. And so one could imagine the numbers are likely much larger as we've gotten closer to today. As well as looking at workplace effects, like needing to quit a job or go part-time or reduce hours in some way. Next slide. The biggest challenge that was facing caregivers was emotional stress, which we've heard through the various presentations earlier today, and I'm sure Greg, no relation, Olson, will share some of those findings that he saw in New York about the stress of handling both work and caregiving. But just thinking about thinking about what's on top of a caregiver's mind, it's this emotional stress of that working a double. Next slide. To me, this is incredibly interesting when you think about how does caregiving or the experience of being a caregiver show up in the workplace, both for the employee themselves who's handling caregiver responsibilities, as well as for a supervisor or manager who might see some of these things happen in the workforce. You know, somebody who was at a time often to seek promotion or additional responsibilities has shifted. You know, maybe caregiving has something to play with that. A colleague who normally was the first to get back to your email has a delay in doing some of that or won't volunteer. And so what is the way that caregiving shows up at work? I think this is important for those who have been in a caregiving role. I think they've experienced many of these things. And for others, you may have seen colleagues or coworkers have shifts in their day-to-day presence in the office, and that's showing up potentially due to caregiving. Next slide. Not surprisingly, we found significant differences in our work by age, race, income, and firm or company size. The biggest challenge remaining that emotional stress across all the different subsets we looked at. But younger adults, people of color, and hourly workers as compared to salary are more likely to experience situations where they had to leave work early or unexpectedly, where they had to call out for a day or two and didn't take on those additional responsibilities or that opportunity for promotion. There's also an increased likelihood of staying in a job for longer than you might want to, or that it's the right role for you. In addition, small businesses, and we said those were less than 50 employees, many of their employees had to reduce hours or go part-time, which obviously increased risk for having to completely step out of the workforce as the challenges of income and responsibilities continued to grow. Next slide. So this just emphasizes some of those differences. I think for me, the reducing hours and part-time, the variability in race and ethnic background, as well as age, is important for us to think about when we think about systems, structures, policies, and programs being put into both employer places and employer-sponsored health insurance or other benefits. Where do those supports need to be emphasized? Next. I think the key here is just looking at those distinctions in the caregiving impact by level of education, income, and size of company, right? There is this variability, and there, like we know in any caregiver situation, there is not a one-size-fits-all golden benefit that's going to support all of these circumstances for caregiver experiences. Next slide. So the caregiver experience is unique, the employer circumstance is unique. That makes this a really complicated challenge, but not one that we have to step away from. We at RCI have been sharing these results with companies and trade associations to help identify what some of the gaps and challenges are, but also to bring some visibility into gaps and challenges related to home and community-based services or long-term care system more broadly, so that employers can understand we don't expect their solution to be, their work to be the only solution in supporting caregivers, but rather for them to understand the ecosystem in which their employed caregivers exist. We also asked people who are employed caregivers of the 10 or so common employer benefits that we may have all heard of at various points, like unpaid leave or specialty concierge caregiver services, flexible schedule or flexible location. 2/3 of the caregivers we spoke to reported having access to very few of these types of benefits. And I'll explain why that matters in a moment. Next slide. As I said, I think we recognize that the variability both in workplace and environment or local resources reminds us that everything is local and there is a great deal of difference to consider. Employers that we've talked to want to know what specific issues are affecting their workforce and what resources are available in their community, not just broad kind of solutions or suggestions. So we are working with specific employers through some pilot programs and follow-on evaluations to understand what supports might be valuable and what policy opportunities exist at both the state and federal level. Next slide. In order to really do this work, we need a better understanding of a few key categories, understand the preferences on what employers can do and what employees need, recognizing that those preferences may vary at different points of the caregiver journey or with different types of caregiving responsibilities. Look at the availability and affordability in specific regions of home and community-based services. We always think of the example of a allowance or amount of funds towards home care, but if that home care isn't available in your community, the fact that you're not using it or the employer thinking you're not using it is not a reflection of not needing it, but rather a reflection of your local ecosystem. Recognizing there is variability and characteristics in the work culture, the supervisor-employee relationship or the manager-employee relationship, and the type of work that makes thinking about supports and benefits complicated, and that there isn't exactly a clear roadmap. So, next slide. I'm excited to share that today, about 2 hours ago, and I'll put this link in our in the chat, we released a white paper that highlights information about the number of caregiver employees in the labor market, the documented consequences from attempting to blend caregiving and work, and the limited amount of progress and actual research, empirical evidence we know about solutions and effective solutions. And so on that note, I'm going to end my presentation so that we can get to questions at the end. Thank you.
Great, thank you, Jennifer. So thank you for that great sort of the table setting for what you all found, you know, in amongst employed caregivers. Now I want to shift over to Greg Olson at the New York State Office on Aging to highlight some work that they've been doing with family caregivers and employers. So Greg, I'm going to turn the floor over to you.
Great, thanks, Greg. Can you see and hear me?
Yes, we can.
Outstanding. Well, thanks so much, Greg. First, I want to just, before I begin, really thank the council for the incredibly thoughtful work and the report. I really enjoyed reading it and then being part of this whole day, because I think there's so many pieces in a really complex puzzle that you have identified that resonate with me personally, but also resonate with the work that we do in New York State. Quick couple shout outs. Dina Prest, my staff who oversees our caregiver portfolio, is on. Doris Green, the director of the New York State Caregiver and Respite Coalition. Ken Genowick, that oversees the caregiver portfolio for the Health Foundation of Western and Central New York. partnership with Ralph C. Wilson. I also saw Lance Robertson and Kathleen Oddie on. So just wanted to say hello and thanks to all of you guys for your support, and certainly Rhonda Montgomery for University of Wisconsin and T-Care, which is something we've been piloting in New York. So let me get right into it, because I think that there's a lot of overlap, and I wish we had a bunch more time, because tremendous amount has been talked about today that I think we've been working on. And looking at some of Jennifer's slides, we're really all kind of on the same page. But give a little bit of background. We oversee a network of 59 county offices for the aging, 1,200 community-based organizations. And what that means is you're providing direct support to caregivers themselves, and then indirect support by having an infrastructure that can actually take pressure off of caregivers. That's critically important. We're a state that has a $25 million investment in the health department for caregiver supports for individuals with Alzheimer's. We have the CARE Act. We have paid family leave. And I really like to focus on kin care. We have over 400,000 kin care families in New York, of which about 330,000 are grandparents of caregivers, of young individuals. And when I worked in the legislature, I helped draft the bill that established and funded the kin care programs and the kin care navigator within New York State. So I really like the breadth of what you guys are all looking at. But I think what you know all too well, and what we know, is if you are a caregiver, and we're going to talk about that term for a minute and hopefully come up with something that helps people recognize what they do other than an industry term that we all use. You have to be an expert in healthcare, long-term services and supports, social services, housing, financial issues, and be advocates. And if that's something that is thrust upon somebody that doesn't have training, education, and support, that is an unrealistic expectation. But that's the way that the system works. And absent the role of caregivers, we know what that would mean, not only for family unity, outcomes from an individual, but also what the cost would be to a more formal system that doesn't need to be that way, if we just understand that any care provided in the community begins and ends with the individual, their family, and then everything else that's wrapped around it. I want to thank Wendy Fox-Grage from Nashville, who's been an incredible partner and helped bring me here today. So I really appreciate you, Wendy. So let me talk to you about an initiative that we started and why this is something you can easily do. And I'll talk about that at the end. Many of you may remember in the early 90s and then again in the early 2000s that MetLife Mature Market Institute did some studies on the impact of caregiving on businesses. And this was private businesses. And it showed about a $60 billion a year loss in productivity. And Jennifer Olson showed all too well exactly where those costs are. And so whether you're in government, whether you're in the not-for-profit sector, et cetera, you know that we are often one deep in many areas. And if individuals are leaving early, coming in late, taking time off, staying up all night with somebody with dementia or that is dealing with pain issues, that has a huge impact on your day-to-day operations. And why we need to stop just talking to ourselves because we know the issues and really broaden the umbrella and the tent to include everybody. And that's what this initiative is all about. I've been doing this work for 30 years, and what I know is lobbying the legislature or lobbying the governor or trying to, get resources for particular programs and services don't work with just anecdotal stories. They should, because they're the right thing to do. We know what the impact is, but they don't work. It's data, it's metrics, it's outcomes, it's return on investment. It's how the things that we're all working on and care about, how they impact you and how they matter to you, which is why it was always a dream of mine to try to replicate what MetLife Mature Market did in New York State. And that's what we've done here. So the initiative that I'm going to talk about was to do a couple of things. And many of this has already been raised today to help HR departments. And when I talk about businesses, I'm talking state government, county government, municipal government, and the private sector. So when we say business and HR departments, we're talking public and private, all inclusive, to understand the impacts of people who are interacting with them every single day that are dealing with many of these issues, and that they're there and that they should know that they're there and what they're doing. We want to better understand the impact of caregiving on the employees. Who are they? What are they doing? What's the intensity? How often? What are the tasks that they're providing? We also partnered with Alex and Archangels from Boston, Mass. And we are sending out in consult with this project the Archangels Caregiver Intensity Index. It was already described, takes less than 2 minutes to put you in a green, yellow, or red so that you can identify what the 2 biggest issues are that are causing stress and provide some recommendations in connection to resources to bring you down a notch in order to provide those types of supports. And then the most important thing, not only for New York, but the country, and why this council is so important, is this is not a state office for aging issue. This is not a health department issue. Caregiving impacts every single system at every single level, and this needs to be elevated out of particular agencies or organization and become a national priority, which is really what the RAISE Council is all about. So again, I'm happy to be here today. Next, please. So why are we doing this now? I'm not going to go through all the demographics, but we have 4.1 million caregivers in New York State. Any care counts. I heard earlier talking about people don't self-identify. Well, they don't, because we use an industry term, caregiving. People self-identify as spouses, daughters, sons, aunts, uncles, grandchildren, grandparents, etc. And we got to figure out a way collectively to get out of the industry term and make this more relevant to day in, day out people, and that any type of care counts, whether you're shoveling snow for a neighbor or getting meals to, doing hands-on personal care and everything in between. I saw some recommendations on a national campaign, and that national campaign should be Any Care Counts, and helping people self-identify based on the tasks that they do, not an industry term that we use. Next, please. Thank you. CBC put out 2 really important reports, September 20 and June of 2021. And again, some of the info that Jennifer just showed you is really important. Now, what I want to really express is that this isn't neglecting non-working caregivers. This is in addition to including working caregivers. Why? I spent a great majority of my youth as a community organizer. We have to broaden this topic and include everybody so that we can come up with a political and an organizing and an infusion of services and support dollars that can get done what we need to get done. But just take a look at some of the stuff that I pulled out of these 2 CDC studies. You've already talked about some of it today. 90% of HR departments want to do something, don't know what to do. So we partnered with our New York State Department of Labor and put out a working guide to caregivers that will be posted post this session, along with a caregiver fact sheet. 85% of caregivers like me, who were home with my kids during the pandemic, but also caregiving for an older adult, which I am for both of my parents, 52% reported suicidal thoughts last year. If that's not an aha, jump off the screen moment for all of us, I really don't know what is. Employers trust their employees. So if we can provide resources to HR departments, when those one-on-one conversations happen, either with HR or with any of us, we're able to connect them with resources. We know that mental health symptoms, 70% of individuals had some type of mental health episode during the pandemic, anxiety, depression, suicidal thoughts. Jennifer showed the data about having to rearrange work schedules, decrease hours, take unpaid leave. That affects your economics, as well as what the industry, whatever you may be in, is doing in terms of their productivity. Next, please. 61% are worrying about caregiving. Again, worry goes into anxiety and depression and mental health issues. More than half don't self-identify. We have work to do here. We can do this type of work by talking about the tasks and the care, and that any care counts. 50% use food to cope. Why does that matter? That affects diabetes, how you feel about yourself, your weight, your physical appearance, again, leading to depression, anxiety, and other types of issues. And then off the charts use to substance abuse and suicidal thoughts among caregivers generally. So, I mean, the data is there that really shows that with appropriate supports, that really is inclusive of the public sector, the private sector, all the things that you guys have laid out during your recommendations today, that we have a lot that we can do. There's a lot that can be done. And that's what we need to be doing collectively by including many, many other people that we traditionally don't normally include. Next, please. So here's what we've done in New York so far. So back in May of 21, we launched with the University of Wisconsin a survey to, again, really assess in New York, both the public-private sector, within the business community, who's doing what, where, when, why, how, and I'll show you some of that data. Our data with Wisconsin closed in November of 30, and we replicated the survey, and we're going to continue to blow that out. I don't need to get a survey response from every single business in New York. That wouldn't be realistic. What I do need is 10,000 or more responses back so that we have a good broad set of where the data is coming in, what type of industry, reaching industries we normally wouldn't think about, like fire and police and transportation and public works, and some of the, the more male-dominated entities that we know are providing much more caregiving tasks, when we used to think it was an older woman who was the, the daughter of an older adult. And that certainly is a huge block, but that's not what caregiving looks like anymore. As I mentioned, we developed a caregiver guide to business. I want to call out again, Dina Press for my staff, where we're getting the guide to business that not only talks about some of the opportunities and flexibilities within the work environment, but connects with the many, many resources that already exist out there that people don't know about, because we don't talk about aging. We don't talk about caregiving. We're afraid to ask for help because that's culturally part of how we grew up in the United States, so that people can get connected to what it is that they need. And then, as I mentioned, we also partnered with Archangels to put out the Caregiver Intensity Index. Next, please. Here's just one sample, and I'm not going to go through this. These slides will be available to you. I was hoping to have an aggregate count of our last 5 months of work, but we haven't received that final report yet. Here's an organization in upstate New York with 100 employees. 60 of their employees are active caregivers. This is what the data we're collecting looks like, what the survey looks like. It doesn't take that long, but you can see it talks about the tasks, how many people you're providing care for, who is the person you're providing care for. Next. Thank you. Sorry, I didn't mean to yell that at you. Are you the primary caregiver? Do they have a memory impairment? Where does the person live? How often do you provide care? How long have you been providing care? What are the typical hours per week? Next, please. How long have, when's the last time you had some time off to yourself? And then what was the impact in your work environment? Next. And then it looks at the demographics and exactly what you would think from a working caregiver. Large Generation X, large number of millennials, large number of spouses, and a large group of baby boomers. So it's not the traditional 59-year-old, adult child of an older adult. It's cross age spectrum, cross disability. It's not an older adult issue. This is an all hands on deck issue that affects every single system, public and private. Next, please. So where are we now? As I mentioned, our partnership with the University of Wisconsin ended at the end of Caregiver Awareness Month, November 30th. We replicated the survey, added a couple new elements, and we're continuing to blow this out and will be for the next couple of months. We are working with the governor's office and our state operations department that oversees all the state agencies to get this into the hands of every civil servant in New York State. We've already partnered with the New York State Association of Counties to get this into county, municipal government, the private sector. We have organizations like JP Morgan, Volvo International, some of our largest healthcare providers in New York State. It's been sent out to the entire Department of Labor mailing list, as well as all of our age-friendly, contacts. So this has been distributed widely, and we're continuing to develop and expand these partnerships. We're working to develop an online training. We're required as state employees and county employees to take 13 mandatory trainings every year. Everything from sexual harassment to IT security. I want to build a 15-minute module that focuses on any care counts and the tasks, so individuals can self-identify. Yes, oh my God, I'm doing this type of thing, and if I need help, to be able to connect them. Something very simple we can not only share within state and county government, but also with the private sector. We have engaged extensively the workforce development boards, chambers of commerce, and businesses. Every single presentation I give, and I'm doing about one a week, you will get feedback from representatives of these workforce development boards and chambers of commerce that will tell their story, because everybody is dealing with this issue, and that gives real fire behind the effort that we're doing to get these surveys out and collect the data. We're also working with insurance brokers who work on behalf of the businesses and their clients to have these surveys and the data and the resources as a value added for their work. And then finally, once we get all these data back, we'll be able to understand, do we have the resources already? Why aren't people connected to them? Probably because they don't self-identify. What are the things that people are saying that they need? Are those things that we need to develop? Are those things that we already have that we just need to do a better job cross-systems marketing for? So this is really important. This is something that can be replicated. You say, wow, this may sound like a lot of work to you. How much did it cost? This cost me $0. It cost me making phone calls, utilizing our partnerships and our connections to talk about an issue that everybody faces, whether they hide behind it in the comfort of their own home or are afraid to talk about it or raise it for whatever reason. And as you do, people will get on board, and we need the private sector on board, because if we have a public and private sector partnership that's showing similar types of data, then we can develop a plan together that really raises this to the highest levels, not only in New York State government, but if this is something that could be replicated across the country, the same type of thing at the federal level, because this is a cross-systems, cross-agency, cross-age, cross-demographic issue that needs that type of attention in order to be addressed. So thank you so much for your time and your willingness to listen to me today. Appreciate it.
Thank you very much, Greg. That is really incredible information, and I want to just point out to the council members that as we're looking at Goal 4 in the development of the National Family Caregiving Strategy, that actually has specific recommendations for strengthening the caregivers' position within the workplace and giving them tools and resources. Something like this may actually be something that you would want to suggest that states take a look at as a way to begin to look within their own geographic areas and within their own state ecosystems to better support employed caregivers, but also to give employers the tools and resources that they need to better understand their employee population and some of the issues that they're facing. So we've had two great presentations on employers and employees who are caregivers. Now we want to sort of flip the coin and talk about one of the other issues under Goal 4, which is about financial literacy and the need to maintain your financial well-being and status as a family caregiver. And so we have Monica Moreno and Dr. Catherine Judge, who together had worked on a project that was funded by ACL. The Alzheimer's Association was the grantee. The project is winding down, but they did some amazing work to really understand what some of the financial literacy needs are for family caregivers and for people who are engaged in financial caregiving, as well as developed a tool that can actually help bolster caregivers' financial literacy and confidence in that aspect of their caregiving. So I'm going to turn it over to Monica and Dr. Judge, and we will look forward to hearing what you all have to say.
Great. Thanks, Greg. So I just want to thank Jennifer and Greg, because I think you did a wonderful job at really setting the stage on the impact of caregiving on an individual's finances, as well as really reinforcing the need for caregiver resources to address this important issue. As Greg had mentioned, the association and working with Dr. Judge have been developing an education program over the course of the last 3 years. And so we're just going to provide an overview of this program and some of the work that went into that. So Kathy.
Great. Thanks so much, Monica. Next slide, please. So just as Jennifer and Greg provided a really nice overview, this slide really just sets the impact. And we did a comprehensive literature review of the current research that's been out there in terms of the impact of caregiving, specifically on financial preparedness and overall well-being. And so it affects nearly 42 million adults that are providing care for an adult 50 years old or older. So obviously this is not looking at the caregiving at the other area of the spectrum. In terms of the amount of hours and cost, it's definitely a tremendous amount in terms of a heavy lift for family and friend caregivers, estimated at 34 billion hours and 470 billion in year in terms of cost. Now, the negative impacts really are quite far-ranging. They've already kind of been alluded to earlier. There's significant out-of-pocket costs that caregivers pay for themselves. There's obviously declines in income and savings, lost pension and entitlement benefits. There's also experienced decreases in future earnings, work-related strains that were highlighted very nicely earlier in the other presenters. And in the research literature, which is a relatively newer finding, is the more direct impact of the financial strain on individuals' actual well-being. So we know caregivers experience a range of depressive, anxiety, and care-related strains. Now there's been some research to suggest the linkage or the role of the financial issue contributing to some of these psychosocial well-being outcomes. We also know and noted in the development for the program here that these difficulties have been amplified by the pandemic. I also want to highlight that several caregiver subgroups are differentially and more negatively impacted than other caregivers, and these include caregivers providing care for individuals with dementia or memory loss, women, individuals who are lower SES, and then our LGBTQ individuals. And then the other large gap we found in the research literature, and just to provide some context, this is also compared in the larger caregiving context in terms of evidence-based tools and resources. We know that there's not a lot of evidence-informed or evidence based programs that are specifically tailored to address these financial needs. Next slide, please. So in terms of the opportunity, we then went ahead, based on this lit review, ran several focus groups and also did interviews with stakeholders for really furthering understanding what are the identified needs of caregivers. And these range from understanding their current and future care costs, so understanding that trajectory of care. The emphasis really was highlighted on how to plan ahead wherever they were at in that caregiving journey, how to identify appropriate resources, and especially resources that they felt were reliable and valid. How to conduct very key financial and legal transactions, because these two issues are pretty interwoven together. In order to conduct financial transactions, a lot of times you have to have key financial documents in place. Another big topic that came up were how to have difficult financial conversations with a loved one when they're maybe needing more assistance in doing some of these financial transactions, and then how to manage financial documents, and then protection from financial abuse and fraud. So these were some of the key identified needs across these different data collection groups that we collected. Next slide, please.
That's me, Kathy. So as Greg had mentioned, the association was awarded a grant through ACL to develop an education program really focused on financial literacy and preparedness for family caregivers. And the goal was really to develop a tool that family caregivers would be able to prepare for their own financial well-being as well as the care recipient. So this was a 3-year grant that we had worked on. I do want to make mention that as part of the grant, we were to form a steering committee, and the steering committee that we formed included representation from the financial industry, such as Bankers Life, also from advocacy organizations, AARP, the Consumer Financial Protection Bureau, SAGE, which represents the LGBT community, the National Hispanic Council on Aging, and we also included a caregiver and someone living with dementia as part of the steering committee. And their role was to really provide guidance and input into the development of the program. Next slide, please. Now, before I dive into the program itself, one of the things that we have learned is that the way that people like to get information and learn has drastically changed as technology has advanced over the years. We know that they want the information to be very easy to be understood. They don't want to be overwhelmed with too much information. Otherwise, they won't take any actions whatsoever. And they want programs to be engaging and interactive. And they also felt it was really important to hear from other caregivers who understood what it was like to walk in their shoes. So we took all of this information, as well as all of the discovery that Dr. Judge did, into perspective when we focused on development of the program. We also, as a result, did a readability. We worked with an expert to look at all of the content within the topic areas of the program to make sure that it was at a 6th grade reading level. Sometimes it jumped up to 8th grade just because there were some terms that we couldn't change because it would actually change the meaning of what we were trying to get across in the program. We also wanted to make sure that we included test your knowledge questions. Again, trying to make this more engaging and interactive for the learners, even if it's an online program or being delivered virtually or in person. And then we also know that they like checklists and being able to actually respond and share their stories as part of this experience. But again, wanting to hear from peers. So we included and we interviewed caregivers who had actually been through this experience, both having both positive outcomes and negative outcomes, to really share their experiences with other caregivers. As far as the topic areas that are covered in this program, we cover the cost of caregiving, how Alzheimer's impacts finances, benefits of early planning, conversations about finances, as Kathy mentioned, because we know that people really have a difficult time having this difficult conversation with their family members, and then how to avoid financial abuse, fraud, and scams. And then also identifying legal and financial needs and creating a backup plan, which was something that was brought up to us in the focus groups. These topics that we cover, I just want to make mention, if you notice, all of them are pertinent to any caregiver, regardless of the disease the person they're caring for has. There's only one topic area in the program that focuses specifically on the unique challenges of dementia caregivers. And that was really important to us and ACL, that in the work that we did in this program, the content that we developed, we were always including caregivers who were dementia and non-dementia. So there was a 70-30 split. So what's nice about this is that we were able to actually reach a larger audience because, again, it's pertinent to the larger caregiving group. We also included, you'll see on the right side of the slide, exercises. We wanted to make sure that not only were we going to be looking to evaluate this program based on the knowledge gained by caregivers, but after they took the program, were they actually going to take that knowledge and apply it into their caregiving experience? So if they learned about tips and strategies to reduce financial fraud, abuse, and scams, did they actually take that knowledge and put those strategies into practice? Those exercises help them to craft a conversation on how to start the discussion about someone's finances or even their own finances if they want to have that conversation with their family. There's an exercise that covers ways to cut monthly expenses. These are really simple strategies that they can implement. And then also, what can they do to actually minimize the risk of financial abuse, fraud, and scams? And then what do they need to do to put legal plans into place? And then planning for monthly expenses, recognizing that care costs, especially for dementia caregivers, will continue to increase as the disease progresses. Part of what we also conducted as part of the development of this program was to conduct a program evaluation. Again, we wanted to build evidence behind the program to demonstrate not only an increase in knowledge, but did it have an impact over time on a caregiver's stress, on their confidence, and their self-efficacy. And also, again, did they take the knowledge that they gained through the program and actually applied what they learned into their caregiving situation? As part of the program evaluation, we recruited over 300 caregivers, again, dementia and non-dementia caregivers, to take this program virtually, and it was delivered by our volunteer community educators. In the marketing of the opportunity to participate in this pilot, we were very focused on ensuring that not only were we recruiting caregivers, but we were targeting those from diverse and underserved communities in varying SES. We know that many caregivers from these communities don't believe or think that they have to put a financial plan into place because they don't have a lot of assets or a lot of money. And we know that because they are impacted even more significantly, they are the audience that really needs to learn about financial literacy and put plans in place so it's not impacting them in their caregiving experience. Next slide, please. So as a result of all of this work, as Greg mentioned, we're kind of in the end stage of this. We conducted the evaluation with those 300 caregivers, which ended in December, and Dr. Judge is actually working on the analysis part of that. But we're also we just launched this past Monday, an English online version of the program in which we'll be evaluating that experience, the delivery of the content of the program through an online experience with 150 caregivers. And then we're also looking to launch all of these programs in March, which will also include a Spanish version of the program, which will be delivered in person as well as virtually. Dissemination of the program is critically important to us and to ACL. It is not going to do any caregivers any good if we have this wonderful program and it's not being utilized in the field and caregivers don't know about it. So for us at the Alzheimer's Association, we have different mechanisms or channels that we're going to use to help elevate awareness of this program. Our 24/7 helpline is specifically for dementia caregivers, but it is certainly an opportunity to let caregivers know about the education program that's available, especially if they're dealing with financial challenges or in the beginning of the caregiving experience and really need to know how to plan ahead. We have our nationwide chapter network, as I mentioned, with our community educators across the country. But we know that we can't just sit back and wait for caregivers to come to the Alzheimer's Association and find out about this resource. We need to be able to collaborate with community partners. And that can represent all of you who are on this phone, but part of our strategy at the organization is to develop these relationships with community partners, those gatekeepers to the communities, especially those who are in diverse and underserved communities, so that we can engage them, recruit them to also be able to deliver this program in the communities where they work, live, pray, and play. They understand their communities better than anyone and can understand the impact and the cultural sensitivities in sharing this type of information with those communities. And then other channels that we have been participating in and are planning to present this information on are at conferences. I know Dr. Judge went to the Gerontological Society of America when we first started this project to do a poster session, and then they're getting ready, her and Dr. Fazio from the association, to present at the American Society on Aging in the spring. And then we're also looking to submit journal articles because we really want this to be peer reviewed and published. So again, we can hopefully with good results in the data analysis say that this is an evidence-based program and that there are positive outcomes as a result of taking this education program. So with that, Greg, I think I will stop and see if there are any questions for any of the panelists.
Great. Thank you, Monica and Catherine, as well as Greg and Jennifer. Three, really amazing presentations, three really thoughtful discussions on some of the critical issues in family caregiving. If you're employed, how do you manage that? And if you're an employer, how do you really begin to work with and support your employees who are also family caregivers? And then, of course, that all critical issue of the financial impacts of family caregiving and how can we provide family caregivers these proactive tools and approaches for really being able to bolster their financial security and financial freedom. So wanted to open it up to the panelists for all three presentations. Council members, did you have questions as you begin to think about how we incorporate the information you just heard into some of the work that you'll be doing on the national strategy, particularly in Goal 4? Are there questions that you had or other issues or topics you'd like to post to them? Feel free to raise your hand and we'll call on you. Or just jump in. Deborah.
Thanks, Greg. I really enjoyed the synergy, and thank you to all of you for presenting. It was very insightful. And it seems like at this point in time, with the nationwide shortage of workers and employers scrambling to attract employees, that this would be an excellent point in time, I guess, to take advantage of the employer need as well. So I'm curious if there might be a sense of what, and maybe Greg, this question might be directed to you, but others might have input as well. But what would be the most effective message to employers from your vantage point? What do you have a hook? Is there a hook we can use to help employers see the benefit?
Yeah, there is, and I think you hit the button on the nose, right? This is a very difficult job market. There are tons of jobs available, and people are leaving their jobs. Why are they leaving their jobs? There's a variety of reasons, but caregiving, regardless of age or ability, is one of the reasons. I watched the jobs reports. It was not uncommon for months in a row for 100% of the job losses came from women. Why is that? They're home with their kids. They're taking care of an older adult or somebody else that might need some assistance. So what's the hook? The hook is the data and the money. You're losing billions of dollars a year. So take, you work at US Aging. I work at the State Office for Aging. If I have one person that is taking care of one particular portfolio and that person's out for 3 weeks or a couple of weeks or isn't 100% on their job or is coming and going because of these responsibilities, which they are, I know that because I do it on the job too, then you are literally lost. How long does it take for somebody who may leave their job to go through the process of hiring somebody? Weeks and weeks of staff time, turnover, loss in productivity. And why it's so important to organize businesses is because the bottom line is what matters. And if we can assist them in helping them understand that their employees or themselves are dealing with these issues, which they are, and that there's a direct impact on their business, regardless of what type of businesses it is, then they can become a partner with us in trying to develop a national framework to elevate this issue to where it ought to be. And not as byproduct or a side thing or something that families just do, but something that we have to organize ourselves around to support. That's good for business, that's good for people, that's good for outcomes, it's good for mental health, it's good for everybody.
Thank you. Gail.
Well, really just a statement, Greg, and I appreciate you letting me know that this was mostly about caregivers with dementia, older adults, but I want you all to continue to think very deeply about how this impacts kinship grandparents. As a grandparent raising a grandchild, I am also disabled. My husband is a caregiver of me as a caregiver and as a disabled person, as I know many of my fellow grandparents are also in the same situation. My husband should have retired, but he can't retire because he's raising a child who is also disabled, which is many of the cases of our grandparents raising grandchildren are raising children with disabilities because they've been affected by drug and alcohol abuse. So I want you, as you're thinking about all the caregivers that are taking care of older adults, also think about the caregivers that are older adults taking care of kin and those that are children with disabilities and our disabilities, because I think we just need to think so much deeper than just older adults.
Well, I agree with you, Gail, and I had mentioned at the outset that we have a pretty good, robust network of kinship care. There's over 300,000 grandparents caring for grandkids that I helped establish that in statute. I couldn't agree with you more. My role today was to really talk about a specific project, but we absolutely agree 100% with you and the various complexities. None of this is easy. And I think one of the things we're most proud of is really the Kinship Navigator, which provides some legal assistance for individuals like yourselves that are dealing with schools and other systems that don't formally recognize you as a caregiver and how difficult those situations become. So you are right on the money in terms of where New York stands.
Thank you. Alan.
Yes, thank you again to everyone for these great reports. Two quick questions for Greg, if I may. The first, I'm wondering, the value of the data is, of course, incredible, and what you're doing there and collecting the survey data. Question, if you can, how challenging is it to get employers to give you the access to do these kinds of surveys? And I'm going to ask something specific about that is, you often hear that people, particularly employees, don't want to do surveys if they don't have specific answers to problems that become brought up or addressed in the survey. And right now, employers have very little to offer in terms of caregiver support. So is that valid? Do you think that is a potential barrier to us collecting more data from employers? And then the second question is, have you looked at data or any kind of surveys within your state retirement systems, either a teacher retirement system or New York retirement system, to see if you can evaluate an increase in the number of people leaving the workforce, retiring early due to caregiving. Thank you.
Yeah, thanks, Alan. So there's a lot there. So the data that we presented is actually quite old. I think the last mature market study was in 2004. So what we're not going to be able to do from this data is aggregate the loss to businesses and be able to put a financial dollar amount on that. But we have two sets of surveys from years ago which show it in excess of $60 billion. Is it hard to get employers to provide these surveys? You know, that's hit or miss. It really depends. What I've learned in presenting to business owners or business groups is it's a mix and match. But when they have their leadership team on, or there are representatives from the HR workforce or other types of organizations, they all resonate on this topic because they've all lived it, which actually makes it a lot easier to get the survey data out. Now, we constructed our survey to do a couple of different things. It can be anonymous, or you can identify the business exactly. So let me give you an example. We have a very large health insurance vendor in New York called Excelis that operates in 31 counties and has 6,000 employees. They did the survey of their own membership and wanted to be able to look at their own member data. That may be different from a small business, of which 95% of New York is small businesses under 100, that might have 10, where there's a risk of identifying a particular individual. But I guess long story short, what I found is the overwhelming majority of people do want to know what's happening under their roofs, because it matters to their bottom line and their ability to get their work done. And the low-hanging fruit is we have this guide to businesses. So at a minimum, share the guide with your HR department, know it yourself, and know what resources are available. Our ADRC in New York is called New York Connects. We have 75,000 caregiver and respite programs listed in our resource directory. So it's not like we don't have supports out there. It's just that, you know, we're an ageist society. We don't plan for getting older. We don't talk about any of this stuff until it winds up being crisis driven one way or another. And so half the battle is self-identification and direction to what already might exist. And the survey data at the end of the day will help us understand what are we missing, where are the gaps, and what do we need to fill in.
Great. Thank you. We have time for just maybe one more question. If not, okay. Hi, Sarah. Yes. Oh, you're still on mute.
Hi.
Yes.
I've been listening to this and I have to tune in with what Gail said. I have to agree with her. And my question is quite literally, where I'm a kinship caregiver who had a full-time job with 6 figures to it. Asked several times to work part-time, and back then was told, no, you can't do that. You can't work part-time and do that. So eventually, of course, I retired because I got more than one grandchild. The other 2 came along, and it just was not feasible for me to continue that type of work. And it hit us hard financially. Where are we in this soup? When will we get included?
You know, Sarah, I think that many of the stories that I've heard today, including yours, are exactly, I hope, why the RAISE Council is doing what they're doing, why we're doing what we're doing. There is no cookie cutter to this. There are so many different individuals doing so many different things. And I believe on the business side of things anyway, and you know, Greg and others can talk about where this is going to go in terms of national health and social service policy, is that if you want to be a competitive business, you're going to have to start to understand and adapt to what the workforce actually needs, or you're not going to have those workers anymore. They're going to find someplace else to go. And I think your question is the $1 million question. For far too long, There's been too much heavily reliant on folks like yourselves, folks like myself with my parents and others to do the heavy lift where the clinical system and the social service system can't do that. That's what we do as families, because that's what we do for our loved ones. And I am hopeful that the development and implementation of recommendations of this council comes with a cross-section of a variety of statutory and policy changes and the financing to provide the infrastructure at the local level to meet the needs of folks like yourselves and others who have raised their voice.
Well said, Greg. Thank you. And that's actually a perfect segue into the final portion of our agenda. But I want to thank Jennifer, Greg, Monica, and Catherine for your excellent presentations. And Sarah, I would urge you that when we begin to meet in subcommittees, that you come prepared to talk about how can we encourage in the national strategy actions for employers that will help them to understand the importance of looking at their workforce and the needs of each individual, particularly those who are caregivers of any kind, and making sure that they have workplace policies and the ability in place to support them in more proactive ways. I think we have some real opportunities here to create a roadmap through the national strategy with some very solid ideas for what employers can do to strengthen their workforce. What I'd like to do now is go ahead and switch and really, all of you know Sarah Markel on our team here at ACL. During the development of both reports to Congress, you know that she was absolutely instrumental in keeping everything moving and everything on track. And I have to say that the two reports that we delivered to Congress, that you all delivered to Congress, reflect a ton of hard work on Sarah's part. And Sarah is now turning that attention and that organizational ability, and believe me, there is a lot to organize here, as well as that creativity in helping us to make sense of the tons of information that we already have that will be presented to you as the council members to begin working on the national strategy starting in February. So I want to turn the floor over to Sarah to really walk you through where we are right now with some of the preliminary groundwork that we've laid in the development of the national strategy, and to kind of give you a sense of where we're going to be heading in the next 3 months with you. So Sarah, it's all yours.
All right, thank you, Greg. Hello, good afternoon, RAISE Family Caregiving Act Advisory Council and Advisory Council to support grandparents raising grandchildren. As you know, my name is Sarah Markel, and I'm pleased to be here today to talk about our process for developing the first iteration of the National Family Caregiving Strategy. So I'm going to talk about two things today. First, I'll cover the input we have received so far from federal agencies on specific actions they plan to undertake under existing legislation to support the recommendations that you all put forth in your reports. And second, I'm going to talk a little bit about our development process and the outline we have cobbled together so far for the actual strategy. But before I do that, I just want to take a moment to remind you of the key sources of input we're using for the strategy development. And that's this slide here on the screen. First and foremost, we have your 2 reports to Congress. And those reports together contain 48 recommendations. And the recommendations fall neatly into 5 goals/priority areas. You did a really great job of lining up those goals priority areas. And some of that was intentional because we knew the strategy was coming. Those recommendations are going to form the foundation of the strategy. And we're literally building up from the goals using the recommendations as a scaffolding. And we're going to hang those actions on the scaffolding. So in addition to the 2 reports, we have the ACL RFI on family caregiving. We also have the SGRG RFI, which is just a rich source of wonderful quotes and input. We have created here at ACL 5 documents that capture all of the concrete actions that NASHB had identified in their research and that you all had discussed in your council meetings And then some of you are actually prolific senders of emails to their resource inboxes. The ACL team took the time to go through all those emails and capture the information they needed that links to a concrete action. And those have been distilled into 5 terrific documents. We also have the UMass Boston report that you heard about today. And that's a key document for us, especially in shaping some of those federal actions, not all, but some. And then we have those action sheets. And if you recall, for both councils, back in November, Greg sent federal representatives of agencies and departments involved in this work and a few others a worksheet with all of the recommendations from the 2 councils. And he asked those federal partners to provide actions that they could undertake under existing authority to advance the strategy. And so in just a minute, I'm going to walk you through what we've received so far. So more to come on that. But to continue our list, we also have NASHP's 5 roadmaps for the states. And those are documents, they're really like these little how-to toolkits of strategies and cool things that states and communities can do to advance the strategy. And they're going to be kind of folded into the strategy, but also they exist on their own. And I noticed Liliana had a question about practical tips for employers. And I want to point you, when the time is right, to the NASHP financial roadmap. And we'll also make sure to cite it in the strategy because there's a lot there on those practical tips. Starting, I think, this week, we have a series of upcoming technical discussions with the NASHP faculty. And that's kind of like where Greg and I are having a tabletop exercise with a board of consultants. And we're opening the hood and saying, well, if the strategy said to do this, what are all the ancillary steps that need to happen? What does this look like on the ground? And so most importantly, your input and feedback is a big part of this strategy. So I've been taking notes today on your comments and discussion items, and hearing you on the grandparent perspective. You're going to be meeting in subcommittee meetings, and we're going to give you chunks of the strategy and ask you to help us fine tune and shape it, and maybe tell us based on your experience how it could work or how it might not work. We're going to be listening and taking notes on that. And a lot of your comments and discussion, you're going to see again in the surrounding text of the strategy. The strategy, when it comes out, will feel like it was written by you. And that's certainly our goal. Could I get the next slide, please? All right. So, as I mentioned, Greg sent out these worksheets back in November. There was an initial deadline of January 7th. So far, we've received input from 12 agencies. Several of those agencies actually submitted their input yesterday and today. So when I made this slide, we only had 7 so far. And here's the cool thing. 3 days ago, when we only had 7, we had 282 actions received to date from across the federal government. And those actions do include grandparents and the family, more generic family caregivers. We've got some additional sets of information that have come in, and we're going to be adding those. But this at least gives you a sense of the scale. Could I get the next slide, please? And this, again, is outdated because it's got the 282 that we had a couple days ago. But it gives you a sense of the distribution of the federal actions that are coming in. And I really want to emphasize that it's not a competition. Every person filling out this form took a slightly different approach. And so there's one agency here where someone entered 4 like mega reports. Like this would be like 12 people working, and they entered it as one action, where another agency entered as multiple actions, something that was just sort of minor tweaks or minor variations. So we don't see here like who's doing the most or anything like that. But what it does show you is that across government, agencies are thinking of all the goals. And I think the fact, this is just Sarah's personal theory, the fact that goal 1 right now has the most actions kind of speaks to the fact that there's an awareness that raising awareness, increasing caregiver identification, both among caregivers and the public and providers, that's something in which everyone has a role to play. And so we're seeing a lot of actions under goal 1 that are very, very tiny actions. Like, in fact, we can click to the next slide and I'll give you an example. I've tried to anonymize these because none of the actions are cleared for release. So I tried to anonymize them and then distress them a little bit so they weren't recognizable. But I wanted to include this so you could see just how finite and discrete some of these actions are, kind of reflecting how big government is and how important it is that we all come together in a discourse to puzzle this out over time. Because so under 1.1, which if you recall, that's the general awareness piece for both councils. It's about help Americans understand just how much value caregivers and grandparent caregivers add. We have one agency that's going to do technical assistance on developing state plans. And in this case, it's ensuring that those state plans include awareness raising. We have another agency looking to increase messaging through their existing listserv. So here they're clearly going to have their communications department make sure that caregivers are included in the content topics. Under 1.2, if you remember, those are the recommendations that have to do with caregiver self-identification. And there you see we've got an agency looking to add resources to an existing online library. And then under 1.3, I threw in an example. We've actually had several of these where several agencies are already talking to each other outside of our meetings, behind the scenes, looking to pull together a little mini collaboration. And so one of them are 3 agencies that have similar stakeholders, similar customers, if you will. And so they're going to do a public messaging campaign just to their own networks. And as I say, these are just random examples, but one of the things I think you can start to see is that those UMass Boston actions, those federal actions, they're very big and very broad. And even though they're the other end of the spectrum, they're very finite, they still align. There's a lot of alignment here, and we're very excited to see that. Next slide. Okay, so we've got a lot of actions. 300 actions actually takes up something like 78 pages just for the actions, right? We're not going to just publish a list of actions. That would be unreadable. So what we're doing is we're developing a matrix that tracks all of the actions, and we have columns to cross-link where actions apply to other actions, populations, subgroups, targeted subgroups for communications. And what we're doing is we're trying to impose a rigorous analysis process so that it's consistent. So the team we're reviewing actions, we're taking a step back and making sure that the federal officials who gave us the actions applied them to the right recommendations. Like, for example, there might be an action that says increase awareness of such and such a support program. Well, is that a 3? Is that about a program, or is that a 1 about awareness? Or is it both, but one comes first? And so we're really trying to think about what's the primary action, what's the subordinate action, and where do they link and cross-link? We're also looking very carefully for alignment with the findings of the consensus groups and those 5 documents with recommendations and actions that you have all been throwing over the fence for the past 2 years. What we're really looking to do is synthesize and create a single narrative that speaks to this entire group, and it's a very broad population. And finally, our next step, our last step, is going to be involve, I think mostly Greg, will collaborate with those federal agencies that submitted actions, and we're going to maybe ask for some counter actions or refine or revise. Like, some of them are so specific, we're wondering, could this also include, just for example, youth caregivers in a messaging campaign? Are there ways to broaden or make sure that the strategy really hits all important audiences? Next slide. So once we get that done, we're going to take it out of the matrix and we're going to put it into a Word document. And I know some of you really were frustrated how long those 2 reports were, but I'm very sorry to say I think the strategy might be long too, just because there's so many actions. But here I've put in just a very high level outline of what the strategy is looking like so far. And we've written about 50 pages, so we are on our way. We're going to have the usual front matter, maybe with a letter, like maybe a letter with 3 authors. And we're going to craft a cool vision statement using those statements you all made earlier today. And we're going to do something creative there. So it'll be nice. And then we've got our terminology, which I think we've seen on this call. We really need to make sure we define properly. And we have hundreds of acknowledgements we have to make. And then we're going to try to write a really tight executive summary. And then we need to introduce to readers who didn't read the 2 reports some of how we got here and why this matters and why it's absolutely critical that the nation take action starting yesterday. And then we have something called cross-cutting themes. And I just want to take a moment to talk about that. The current administration and ACL is committed to certain themes that are permeating all of our work. And they are person-centered care, the impact of trauma on people of all ages, diversity, equity, and inclusion, and that issue of the workforce, the paid caregiving workforce. How are their needs intersecting with the needs of family and caregivers? And so we're going to discuss those cross-cutting themes, and we have some recommendations and actions from outsider stakeholder groups who've provided us some really great insight. And we're going to make sure that those themes are woven throughout the strategy. We're thinking maybe as examples, tips for success, maybe some boxes, but we really want to make sure we hit these important issues throughout the strategy. And then we come to this bolded bullet here that I have. It's strategic actions by goal. That's really the strategy. That's the real strategy. That's going to be 5 chapters, 1 for each goal. And each chapter is going to have like a cookie cutter structure. It's going to talk about the overview, the general strategic vision for the goal, a strategic vision for each recommendation. We'll have all the federal actions listed, hopefully in their refined and expanded state. We're going to have the state, local, and federal actions, including some analysis and input from you from your subcommittee meetings. And then we're also going to discuss barriers to success. What is going to need to be in place to get all of this off the ground? And then what are the signs that we would use or look at to know that a certain goal is a success? And that's one other thing we're going to be looking at you to think about and discuss in your subcommittee meetings. How do we define success for something so broad, but in a way that's meaningful? And then we have some end materials. I am very hopeful at the end that we can include a matrix of federal actions. The Public Affairs Department might be a bit frustrated at the size of the table, but we're going to figure out a way to do it, even if it's just a spreadsheet that someone could be available for download. And I think, is there another slide? Oh, that's it. So that's the strategy document process in a nutshell. And it's very much a journey, and we are all on it together. And I'm going to be listening to your thoughts and your input and reading your chat and looking forward to sharing the document with you at some point in draft form, and then also getting your feedback so we can make sure it reflects the work of this blended council. Any questions?
Sarah, thank you. As you all know, if anybody can keep us organized and on track with analyzing and bringing together massive amounts of information, it's Sarah. I want to just let you know that the framework that Sarah has put together, you all are going to begin to see that in your subcommittee meetings. Beginning in February, we're going to be working with each of the subcommittees that are going to be formed around one of the goal areas. So essentially, one chapter, each subcommittee will focus on one of those 5 chapters, and you'll be allowed to choose and participate in as many of the subcommittees as your calendar and your fortitude permits. And you'll be working through those chapters, as Sarah said, to begin to help us refine the actions, put some examples to them, making sure that we're not missing anything. And actually, especially for the sub-federal actions, for things that states can do or communities can do, we'll need to provide some specificity and some ideas, and we can draw on the great ideas from presentations that we've heard today, but also, in past presentations, we have, a trove of documents and archived materials that we can, refer you all to as you do the work. And we're going to do these meetings in a very structured, very supported way with all of the council members, so that we're going to provide you with prep materials ahead of time to review, and then take a very structured approach in these subcommittee meetings to really elicit your input. So as I said, tomorrow morning, council members, you will receive an email from the Raise mailbox or the grandparent mailbox with a doodle poll asking you to sign up for one or more of the subcommittees. Each of the subcommittees each of the subcommittee selections will have the meeting dates and times already ahead of time, so you'll know what you're selecting. You can look at your calendars while you're doing the doodle survey, and you'll know that you'll be available for those meetings. We felt that that was the best way to do that. This is a surprise for the co-chairs. We're going to ask each co-chair to sort of head up one of the subcommittees, so that we have some council leadership present at each of the subcommittee meetings. But Sarah and I and Virginia Bell on our contract team, and Lori, we will all be working very closely with you every step of the way as we get this whole process started in earnest, so that we can wrap this up. Any questions? Any final thoughts? Does that process sound workable to you? We've got a lot of work ahead of us, but I think it's exciting, and as Secretary Becerra said, it is so important. Anybody can just jump right in.
Greg, Alan, it's time to ask a question to Sarah.
Sure.
Sarah, the cross-cutting themes, there was the impact of trauma. Mm-hmm. Could you speak more to what's included in that? And let me just reveal my bias here. Not sure that language resonates with family caregivers, who often don't see their role as being traumatic, challenging, hard, but they select it. They get value from it. I'm a little concerned about that language and how it's portrayed throughout our document.
Absolutely. Thank you.
If you'd like, I could take a stab at that.
Go
Sure.
ahead.
So, Alan, this cross-cutting theme isn't necessarily about traumatic experiences in caregiving so much as it is about the impact of historic trauma in the care recipient's life, or perhaps in the life of the caregiver, that could somehow impact or impede their ability to accept or benefit from services and supports. So it's really about taking into consideration, for example, if there is a history of trauma for the person receiving care and support, that a respite worker would need to know about in order for that respite service and that respite provider not to re-traumatize the care recipient, so that when the caregiver gets home, they're not walking into a situation where they're having to deal with somebody who's very upset, or who has been, basically triggered, or, by their traumatic histories. So it really is about the incidence of historic trauma, and how we work to acknowledge and understand that, and incorporate that into all of the approaches that, where it may be applicable. Does that answer your question?
Yes, thank you. That helps clarify that a lot. Right. The word trauma just can often be off-putting to people, and
sure, yeah,
those who have not effectively dealt with.
Exactly. Yeah, no, we're really talking about trauma-informed approaches and trauma-informed care. This will be especially critical too in when we think about how do we strengthen services and supports for kinship and grand families, since so many of the kinship and grand families that form out of or as a result of very traumatic experiences for the children. And so that has to be taken into consideration.
Right. Thank you. That's a great deal.
Sure. Other questions? So there's a question in the chat about whether others will be invited to participate in subcommittee meetings. That is a possibility. We've done that a little bit in the past, where if a subcommittee is deliberating a particular topic or wants a bit more information on a topic, perhaps additional background or to understand the research in the space, there's a very good chance that we would be reaching out to additional people and bringing in subject matter experts to inform and to consult with subcommittees. So it is very much a possibility. Other questions or anything before we wrap up? Okay, well, this was it was great to see everybody. It was great to finally bring these two advisory councils together to begin in earnest focusing on a cohesive approach to a single national strategy that's going to better support and recognize family caregivers. Look out for an email tomorrow with the doodle poll. I would love to see 100% participation in this doodle poll with everybody signing up for at least one subcommittee. If not, I will come knocking to get you to sign up. We need everybody's input. This is so important. And with that, if there's nothing else, we will adjourn and be in touch very soon. Thank you all so much.
Thank you, Greg.
Thanks, everyone.
Thanks, everyone.
Bye.
Thanks.
Thank you.
Thank
Bye-bye.
you.
Thank you. Bye-bye.
Bye.
Oh, bye-bye.
Thank you so much.
Oops.